Everyone, and welcome.
Morning.
We are asking you to please share your name and your state and your role in the chat box so we can all meet one another as you're joining in. And I'm Meryl Levine, and welcome to all of you. I know quite a few, but we've got a lot of new faces joining us this morning. So welcome, welcome. We're really excited. We got a great program plan today. So please share your name, state, and role in the chat box as you're coming in. Okay. I'm going to give it a few more minutes as people are still coming in here and then get us started. So again, welcome to everyone to the Birth and Foster Parent Partnership convening. We're so happy to see all of these faces, new and as well as our ongoing national work group members. So welcome to everyone. Again, as you're coming in, please share your name, state, and role in the chat box. And for those of you who are new to this movement, we just wanted to share with you that the terminology BFPP is commonly heard, and we wanted to make sure everybody was knowing what that stood for. BFPP, Birth and Foster Parent Partnership. So you'll probably hear that terminology a lot all throughout the next 2 days. So welcome, welcome. Our focus is on transforming policies and practices that support building long-lasting relationships between birth parents, foster parents, kinship caregivers, as well as staff. We're so pleased to have members from the ongoing national work group, as well as all of these new members that are joining us today. And we have a total of 105 participants that are going to be attending this 2-day convening. So we're really, really excited to hear all of that. We have a total of 38 birth parents, 40 foster parents, or they may be foster and or kinship care providers, the number 40. And we have about 27 staff also joining us as well. So that's a pretty exciting number. And all of those numbers were representing about 22 different states all across the country. So we are definitely growing. The Birth and Foster Parent Partnership itself was established in 2016 by 3 partnering organizations, and they include the Children's Trust Fund Alliance, the Youth Law Center Quality Parenting Initiative, as well as Casey Family Program. Today, we have a powerful national work group that has continued to promote this important movement of building these connections. Our members really developed and worked really hard on developing some excellent tools for building strong partnerships between birth parents, foster and kinship care providers, as well as staff. During this past year, we've really been promoting and introducing these tools to child welfare agencies, as well as other service providers all across the country. And when I sent out the information to everyone to join, we did also put the links in so that you could access those tools. And so I hope you'll take advantage to make sure that you can see all of those different tools. If you are new, please, we hope you'll take a look, because there's lots of exciting information about how to build those partnerships. And we do have some introductory sessions coming up between now and the end of the year that we'll share with you if you're interested in scheduling to come and learn more. It's so exciting to see how this movement has really grown, and these 2 days will help us in growing even further. We're here together really to support one another in this work, and it is important that we all assume best intent during this 2-day meeting. Let's keep promoting the importance of vital partnerships between birth parents, foster parents, kinship caregivers, and staff. This includes breaking down barriers and any misconceptions. So we all have a role and responsibility in helping to do that. We will be giving out now more on a housekeeping kind of note before we actually get started in hearing from our 3 partnering organizations. We will be giving out door prizes throughout the entire 2 days. And our first door prizes are going to go to Shauna King, who is a birth parent from Minnesota, and Jessica Lloyd Rogers, a foster parent out of Oregon. They were the very first 2 to register. So they're going to receive the first 2 door prizes of $30 gift cards from Amazon. We have one 10-minute break today for each day. And we will rejoin after each break with drawings for the door prizes. So hopefully you'll be able to come back in a timely manner. So you'll be in the drawing in order to have an opportunity to win. We hope that you're really going to enjoy the next 2 days and get engaged by sharing questions, comments. If you have resources that you want to share with the group, please feel free to add them in the chat. As you know, and we are recording, and I just wanted to remind everybody, I know that you've been contacted a lot by all of our staff, but we wanted to make sure we are planning to, we are recording this 2-day event, and we'll be posting some of the presentations up on the Alliance website on the BFPP webpage, the dedicated webpage that we had. We sent you a link to provide us with consent to do the recording. If you've not responded, Kara is posting also the link in the chat box. So you can take the next few seconds to fill it out while we're still opening up. If you do not wish to be recorded, then please turn off your camera. You all should have received an agenda as well as a participant list. After we sent out the first version of the participant list, we did find a few errors. And so we have posted a more updated version in the chat box as well. So that would be the latest version. I would say to you that after the convening, there were some people, unfortunately, we couldn't get into the book because of the timing and that we had to go to print. And so we will include those people that want to be included. There were some that chose not to, and that's fine too. If you experience any kind of difficulties with technical issues over the next 2 days, we would really appreciate it if you could private chat to Trish Hallmark, or you can email her at trish.hallmark@ctfalliance.org. She will be on the lookout to make sure she can assist in any way she can. In terms of convening objectives, I know that these have been listed in the agenda and on the side of your actual agenda that you have that we sent out, but I just wanted to highlight these for you. These are the 4 main areas that we are planning to cover over the next few days. We want to engage all of you as much as possible in discussions around successes and challenges as far as transforming and moving towards relationships and connections between birth parents, foster parents, kinship caregivers, and staff. We also want to learn about current and emerging policies, focus in on strengthening the capacity of all of the members of this movement to really inform policymakers around what are the issues that we can focus in on to help build these kinds of partnerships. And we will also be talking quite a bit about using the new birth and foster parent partnership tools and how we have gotten them out there to multiple audiences. And now, without further ado, I know that all of you have gotten your agenda as I indicated. And again, if you didn't, it is in the chat box and you can download it from there, as well as the participant list. I just wanted to highlight for you, this is our plan for the first day. You will hear shortly from the 3 partnering organizations, and then we will begin to move into our different presentations. And of course, many of you I know already know, because I was very excited and announced that even on the save the date that we do have the Associate Commissioner, Asia Schomburg, joining us for the opening session. We will then have a more of a workshop style panel presentation after we hear from the Commissioner on birth and foster parents and how they're leading systems change, take a break, come back, and then we're going to hear about a really innovative model for co-parenting that's happening in Oregon. And then we're going to move towards the end of the day about talking around what are the differences that the tools are making right now, how are we promoting them all across the country, and then we will wrap up for our first day. And with that, before, just to share with you, these are where the 22 states are represented that we have for participants right now, including birth and foster parents all across the country. We are making major progress, very, very exciting. We started out at a much smaller amount when the movement first began, so you can see what is happening. And now I'd like to turn it over to Jennifer Rodriguez, who is going to introduce her team. She is the Executive Director from the Youth Law Center Quality Parenting Initiative. So Jennifer.
Hi, everyone. Good morning. Good afternoon to some of you that are on the East Coast. It is so good to see so many familiar and friendly faces here and to meet those of you who we haven't met already. For those of you who know and are involved with our work, the Youth Law Center is a national advocacy organization. We are focused on ensuring that every single child who has to enter the foster care system has the opportunity to thrive into adulthood. And we've been working on this issue around supporting partnerships between birth and foster parents now for about the last 13 years. And I want to just say that part of the magic of your leadership and bringing you all together, you're going to hear about in a session later this morning that's going to be facilitated by one of our QPI staff, Carol Edwards. And that is that a group of birth parents and youth years ago, and one of them, Pasquale, is here today with us, came up with this idea around how to really support and nurture co-parenting partnerships. Was really simple and brilliant comfort calls. And now, all of these years later, I think we're about 7 or 8 years later, that idea has been instituted into policy, statute, practice in 2 new states and counting. So you're going to hear about that new legislation and policy later on. But this is an example of the kind of leadership that exists in this group and the way that each of you has been changing, really the way that foster care is looked at across the country through your leadership and your advocacy. So I know each of you has been up to supporting this vision from the last time that we met together, whether that has been working on policy implementation or policy reform or practices in your state or area, or that's simply been being in relationship and living the values of the partnership with the parents that you're working with. We see you, we appreciate you, and we're glad for your leadership. I want to just take a moment and introduce my other YLC QPI colleagues. I mentioned Carol Edwards, who will be facilitating a session today. And then we're also really lucky to have Brandy Hudson with us, who is our QPI strategy director. So you'll have a chance to meet her later on, but we are so thrilled that all of you are with us today.
Thank you, Jennifer. And we're going to move on to our next partnering organization, and that would be Casey Family Programs. And I'm going to turn it over to Nicole.
Thank you, Meryl. Thank you, Jennifer. And really good morning to all of you. As Jennifer and Meryl have said, it's nice to see familiar faces from across the country, 22 states, and it's nice to see new faces. And we hope that you will find value in this movement. As Jennifer outlined, really is this opportunity to really progress child welfare, to think differently and think about how to support families to help children thrive, no matter their placement. And the partnerships between birth and foster parents are really central. And so for those who don't know, let me introduce myself. I'm Nicole Dobbins at Casey Family Programs. I'm on our national partnerships team. And KC Family Programs is a national operating foundation solely focused on safely reducing the need for foster care in the United States. Our mission is to provide and improve and ultimately prevent the need for foster care. And we do that in partnership and working within 50 states, Washington, DC, Puerto Rico, and the US Virgin Islands. One of our values is partnering with those who have the experience of engagement in child welfare. And so really this movement is driven by parent leaders, and we're supporting partner organizations. So we're really happy to be in partnership with the Children's Trust Fund Alliance and Youth Law Center, QPI, who bring different value sets to this work, but really centralize the engagement of those with lived experience. And we find that to be so important and critical to the movement we're trying to see. So I'm joined by my KC colleagues who may pop in and out during the next 2 days. Margie Hunt, who's on National Partnerships team and who is my supervisor, Kikora Dorsey, who's on the Technical Assistance Unit, Lauren Basutti on our Public Policy team, Kara Wood, who is also on our Public Policy team, and 3 strategic consultants from KC, Ron Murphy, who represents work in jurisdictions in Washington and Nevada, Bill Stanton, who works with Oregon, Nebraska, and DC, and Susan Riley, who works in Connecticut and Rhode Island. I also want to take a moment to acknowledge an amazing parent leader that unfortunately we lost last October. She was a vibrant member of this movement. Her name is Karen Ezram, and she was out of Columbus, Ohio. She was the mother of 10 children, and she passed away last October. And it would not be right for us to bring her heart and soul, because she really was a huge contributor and collaborator, and honestly, the most warm and vibrant person that you may have ever met. She brought a lot of soul to this work, and so we want to acknowledge her contributions. Lastly, I just want to say that the word movement has been said already, and that's really what this work is: changing hearts and minds, gaining political will, and really recognizing that incremental steps lead to giant leaps. And all of you are a part of that. And so we're just thankful that you're interested in collaborating and partnering together. And we're really excited for the next 2 days and what that has in store. But we're also excited to continue to track the changes that are going to be made across the country with your loud voices. And so with that, I'll turn it back to Meryl and the team.
So thank you, Nicole. And I'm now going to turn it over to Teresa Rafael, Executive Director of the Children's Trust Fund. And she is our leader in terms of moving this effort forward for the Alliance. And so I will turn it to you, Teresa.
Thank you, Meryl. And hello, everyone. We're very excited to be here today. And I'm very happy to, as others have said, but to see so many familiar faces and ones whose work I appreciate so much and value, and then some new faces. And that's really, as we'll be talking these next 2 days, that's really what building a movement is about, is gaining new colleagues, building on the experiences that you who are new bring to this work, and then those who have been part of it from the beginning also bring. So we have a font of wisdom and expertise and experience in this Zoom with us for the next 2 days. And I look forward to learning from all of you. I'm the Executive Director of the Children's Trust Fund Alliance, and we just are just celebrating our 31st anniversary last fall. So we began as the national membership organization for state children's trust funds. If you don't know about the one in your state, they're all listed on our website, and you might want to look and see if maybe you're even already partnering with the one in your state. They all have different names, but technically they're all children's trust fund. They're all created by state statute and have been around since a movement for beginning them in about the 1980s. So they're pretty seasoned and aware and still very active and involved. Their goal, and a primary goal of ours, is to help strengthen families and communities so that children and families can receive the care and support that all children and families need, whatever the situation. And that led very early on in our work to an understanding that we really need to partner with those with lived experience, because there is no expertise that will replace that. It's what we all bring to the table that's so important in this work. We've been very grateful in the last more than a decade, really, to be able to work with Casey Family Programs around bringing the birth parent voice to the table for policy and practice discussions. And now to be able, in the last 6 years or so, to bring foster parents and birth parents together. There's such a powerful force when you all come together and combine your voices. And we're really honored and pleased to get to be part of that work with you all and with our partners at Youth Law Center and Casey, as you've just met. I'd love to introduce the rest of our team who are here. I think you'll be seeing a lot of them in the next 2 days. And I'll start with Meryl Levine, and you already know Meryl better than you know me, so it's a little odd to introduce you, Meryl, but we're very pleased. Meryl's a senior associate who leads this work with the Alliance, and we couldn't be more appreciative of all the work that she and her team do. We also have Jim McKay, who is the Public Policy Director for the Alliance, and he brings that work around public policy into all elements of the work that we do, including the work with you all. And you'll get to hear from Jim later, and I think you'll really understand why we appreciate him so much. We also have Kara Georgi, who is here as a parent leader consultant and brings the parent voice into all of the work we do internally and most of what we do externally. So you'll see Kara a lot. And then Trish Hallmark, who is our administrative assistant. And I think you've already met Trish too. So just so you know, their connection. And then Chloe Corian, who is a student intern and has really just made a place in our work and in our hearts. And so we're very grateful to have you here, Chloe, too. Thank you all for being here. Thank you in advance for all the rich contributions I know you'll make. And I look forward to the next 2 days together. Meryl, I'll turn it back to you.
Thank you, Teresa. And thank you all to all of our great partners. We are here today because of all of the leadership and support that they have lent to making this effort such a successful effort as where we are today. So with that, I'm going to move us on. We're really, really excited and looking forward to being with all of you today, and happy that we're going to be opening up with a presentation and some discussion with the Associate Commissioner. But before we do that, I'm going to turn it over to Sharonda Selovanoff from Washington State, and let you, Sharonda, introduce yourself as well as the Associate Commissioner.
Thank you so much, Meryl. Good morning, everyone. I am so excited to be here amongst all of my friends, colleagues, peers, co-conspirators. The list goes on and on. So just a really exciting time. I'm Sharonda Selovanoff here in Gray, Washington State, as fall has made its entrance, and we are about to be locked in our homes again. I'm quite sad about that, but I won't go there. Kinship caregiver, birth parent, doing some work here in policy, and I've been doing an incredible amount of work here in Washington State just around building the birth and parent partnership. So I'm excited for this time with us all, and I'm really looking forward to having some time today with Commissioner Schoenberg. Commissioner Schoenberg, is the Associate Commissioner, and she heads the Children's Bureau, which is located within the Administration of Children and Families at the U.S. Department of Health and Human Services. Schoenberg joined the Biden administration in March of 2021, and after serving as a senior administrator for the program oversight for the New York City's Administration for Children's Services, also known as ACS. I've had the opportunity to meet with her, and when she was first appointed to this position. We have a kindred spirit from the beginning, and she has shared our passion for helping to ensure that the federal government supports what we all know to be best practice for the well-being of children and their families. She has many accomplishments that I won't share here, but I encourage you to read her biography in the agenda and learn more about her extraordinary background. Following her remarks, we will have questions and an answer period. And now I'm going to turn it over to Commissioner Schoenberg.
Hi, good morning, everyone. Thank you, Sharonda. Good morning, everybody, or good afternoon, depending on where you are in the country. I'm here in New Jersey, hanging on to whatever's left of summer and bracing myself for fall. But I'll enjoy it while it lasts. My name is Asia Schomburg. I'm the Associate Commissioner of the Children's Bureau. I'm so excited to be here with all of you today. I was committed to being here the moment that I received the request back in June. And I've had the great pleasure of getting to know many of you through the BPAC. And in fact, already during my short time here, I've sought your counsel on several occasions. My time with the BPAC has been invaluable, so much so that I even decided to share the wealth of their knowledge with my colleagues in ACF. And I invited the BPAC to lead our equity advisory group at one of our earlier meetings in June, and it had an impact. I want to take a moment just to thank each of you whom I've had the pleasure of speaking with and who have taken the time with me as I figure out these new things in this new role. I truly appreciate it, I truly do. So I've been asked to talk to you all today about three things, and then I think we're going to have a discussion where hopefully I'll get to hear more from all of you about your priorities and areas where we might collaborate. I've been asked to share my thoughts regarding, one, why is it important to reshape foster care as a support to families? Two, ways the federal government can support advancing equity for parents and families engaged in the child welfare system. And three, the role of ACF in normalizing birth and foster parent partnerships and in supporting agencies to think and act this way. You'll hear me use ACF and ACYF somewhat interchangeably. I prefer ACF just because it's the broader group of my sister offices. So I want to start by saying a moment in time does not define a family. I want to propose that we start betting the house on the village. Foster care is so complicated as a system, and its history is so painful. By the 1900s, the federal government began allowing states to step in and remove children from their parents. Parents who paid the ultimate price for being poor were separated from their children, who were then put on trains and sent to live with strangers in other states. Now, depending on who you ask, they were either saving children or providing a labor force to certain regions that were in need. This happened to Native American children who were removed from their parents and placed in boarding schools in order to, quote, civilize them. These children suffered countless abuses. In 1909, the White House held its first conference on the care of dependent children, and as an outgrowth of that, a view that the government should be responsible for child protection. 3 years later, the Children's Bureau was born. That was in 1912. And nearly 110 years later, I'm leading the Bureau and sitting here with all of you who've been impacted by the system in a myriad of ways, and I'm asked to contemplate this question: why is it important to reshape foster care as a support to families? And this is really hard for me because of all the examples that we can all point to factually where foster care hasn't helped at all. I know even as I contemplate your question that foster care has arguably, in some cases, done more bad than good. Yet Black and Indian children are being separated from their parents at disproportionate rates. That only proves one thing: that racism and bias is rampant in our child welfare system. That Black and Brown parents are at the wrong end of what I'll call hypersurveillance and targeted government interference. I'll name it. However, in the many years that I've been doing this work and supporting children and families, I know of many stories where foster care has been a support to families. I met a woman in March, just after I started this job, who said, "Foster care saved my life and my mother's life." I have a fellow colleague in ACF who told me recently that her mother, quote, needed a minute, and that she was grateful that her mother was given the respite and the mental health support she needed to be a better parent to her and her brother. I think that should be the gold standard, the requirement and the expectation. Foster care is an absolute last resort. Foster care must help birth parent families, not replace and not hurt. The requirement should be that if the system must get involved, then the system must make things better. So I'm sitting here thinking, can we reshape it? And if so, we'll have to force it. We'll have to use laws and rules and policies to force it into a different shape. And I still wouldn't bet my house on a reshape or a different shape. I'd bet my house, though, on building an investing in communities and families to know what they need and to secure it. I'd bet my house on the it takes a village approach, and I'd put my faith and my trust in the village. So let's shift toward what the federal government can do. The federal government can bet on the village. I think until now, the federal government has been betting on itself and putting the trust and the resources in itself. However, to advance equity for parents and families impacted by child welfare and other systems and federal programs, we have to listen to the parents. I've been using this word co-design, which I heard a young person use a couple of months ago, and I love it. The federal government needs to co-design. That means create with parents from the beginning, from the jump, as we say in my family. Where are the parents at this table? And if they aren't there, then the work must stop until they are. It means listening to parents who are at the table and seeking input from parents who are not at the table. It means going out of your way, feds, to find the parents who have been through it or who will be impacted by it. I joke with my colleague that I have to stop myself from asking for meetings with the BPAC because I'm afraid I'll start getting on their nerves. It means trusting that parents can create policies themselves and that they're in the best position to do so. There can be no progress without parents. In order to advance equity for parents and families, the federal government has to come to terms with and give up fear so they can give up power. It means trusting the village to take care of its communal needs and its children. It means betting on the village. The federal government isn't there yet, but we're trying. We're starting with ourselves and how we administer our programs. We're acknowledging our own biases and fears. We're scrutinizing our own inequitable administration of programs and funds. We're naming it. We're figuring out how to do what we need to do to transform. And we're consistently reminding ourselves that we must listen to what parents are telling us. One parent from the BPAC said in a meeting, quote, put the money in the community. And then in a different meeting, the same parent said, put the money in the community. And it keeps replaying in my head. Put the money in the community. Equity can only be achieved by giving power to those who have been deceived. Bet the house on the village. So now let's talk about normalizing birth and foster parent partnerships. Earlier this year, I gave remarks at an event and I spoke about attending my friend's mom's funeral. My friend and her 7 siblings spent their entire childhood in foster care because their mom had mental health issues that impacted her ability to parent. They had a loving, supportive foster mom who even 25 years later is still in their lives. I sat with their former foster mom at the funeral. I listened to all of the children pay honor to their mother and sing the praises of their foster mom. It was very clear how much they loved her and very clear how much she loved them. It was obvious. That's how it should be. By fostering strong relationships between birth and foster families, we can improve outcomes for the whole village at all points of the journey through the child welfare system. Okay, and what about parents, all parents partnering with the system? How do we make that work? So remember the fear that I spoke about? I said the federal government has to come to terms with and give up fear. In my opinion, the powers that be fear the people. In this case, they fear the birth and the foster parents. Think about it. They have to come face to face with the people who have been wronged by the system that they're working within and sometimes leading. For example, they've run through the village, they've identified the problem. Let's say we don't like what you feed the children in that village, or we don't like how you clothe the children in that village. And they've taken the children from the village and they've made determinations about what the village parents need in the interim. And then to add insult to injury, when they've returned the children, sometimes the children are worse than they were when they left the village. And now partnership requires sitting across the table from the children, parents, and grandparents of that very same village. Well, what a reckoning. Partnership would require conquering the fear, owning the wrongdoing, apologizing for the wrongdoing, and trusting the village to steer the ship so that history doesn't repeat itself. So what would I say to my colleagues within ACS? I'd say, don't be afraid. Give up the fear. I'd say it's safe to say we've been going about this the wrong way. I'd say, let the village show us the right way. And I'd say, bet on the village. Thank you for having me.
Thank you. I'm going to give you a virtual round of applause there. See if I can get some of my other peers here to do the same thing. Fantastic. You're seeing that love coming for you. Seeing that love coming for you. Thank you so much for what you shared there. And I was struck by a couple things. I'm also going to just preface, I want to just tell everyone, please either put your questions in the chat. I do love community and I love relationship. And if you feel like you want to speak, please do. Like, this is a conversation with our leaders. So we want to have you all a part of this. So one of the things I was struck.
Sharonda, so if somebody wants to speak, let's let them raise their hand and we'll make sure to have that happen. Just wanted to let you know that, okay?
All right, thank you for the structure there. I need that. So first of all, one of the things I was really struck by was first of all, the analogy around the house. And I was thinking about how we have families, communities that really can't even afford bare necessities. And those are some of the reasons why an actual system would come into someone's life. And so I'm curious to just get a better understanding. How do you see the government, your administration, really helping to bring the resources necessary into the communities to remove the likelihood of them even having to come into contact with child welfare? You are muted, Commissioner.
Oops, I was doubly muted, I'm sorry, but thank you for that question. I'm thinking, when you say that, in some communities, not having a house or not having certain resources are the reason why the system, the child welfare system gets involved in their lives. That's true, but it shouldn't be, right? If there's a system that has to get involved in a family's life because they don't have the resources that they need, this is what we're all talking about, the conflation of poverty and neglect, then what we need to do is make sure that we're giving families what they need to be better parents and to be good parents and provide for their children. And so I've been thinking a lot about what the federal government, the federal government's role in all of this. And actually I had a conversation this morning with some colleagues of mine in the Children's Bureau as we start to strategically plan for what we are prepared to do. And so the first thing that comes to mind is when I think of, like, for example, housing in and of itself. You brought up the analogy of the house. And one of the first things I did in my first couple of weeks in this role was I called out HUD for certain rules that are attached to their housing vouchers, which I believe destabilize families. And I guess, HUD then reached out to me and said, we want to talk to you about what it is, what it is you feel like we're doing or not doing that is exacerbating the destabilization of families. And so we've had this meeting already, and we'll continue to have meetings about, what they need to do to address. There's certain particular rules in their regulations attached to their vouchers that do this. And so they've heard me. and they're moving in the direction of eliminating some of those things, for example. And then when I think about just in general at the Children's Bureau, you know, what do we have? We have money. I talked about the BPAC family parent who said, let's put the money in the community. And so I want to really look at, like, you know, what are our grants saying? Where are they going? Or is the money and the resources that the Children's Bureau brings to bear actually landing in the hands of the communities that need it? And in my conversation this morning with my colleagues, they said, a lot of our money, it's the state passes through the states oftentimes. And so we have to get to the bottom of that. And so that's a journey that I'm on, to see to it that the resources that the Children's Bureau could bring to bear actually land in the hands of the members of any community. So I hope that helps to answer your question.
Yes, it does. I want to just kind of go on to the building of the partnerships, because what we're talking about is also building community, the power of connection. We all have a need to be connected to someone, to somebody, to something. And so how do you think that the Children's Bureau can actually encourage leaders to champion the birth and foster parent? And I want to put kinship in there, because kinship is so big too. In partnering and building partnerships?
Yeah, I think, well, first of all, there are some best practices out there that I think that, you know, the Children's Bureau can share. You know, we have obviously a central team, but we're also divided into 10 regions. Every region I know, because I've been to virtually to the regions many times, and I've met with many states just in my role here. And I know that there's a lot that certain states, for example, certain jurisdictions, certain tribes can learn from other states or jurisdictions and tribes. There are areas where we're really doing great work in the areas of partnership. I like to say that New York City does great work in the area of partnerships, but that's because I've spent 20 years in my work in New York City. And there are areas that, you know, aren't doing very well. And so I think there's an opportunity, one, for a learning exchange. I think sometimes, honestly, there's, you know, leadership has to, whatever leadership, whether there's leadership at the Children's Bureau, leadership within the local jurisdictions and the state jurisdictions, leadership has to be there too and has to model it. Not everybody has what it takes to really authentically say, you know, here's why partnership is important. Or, you know, here's why we're going to come together, even, let's say, even from a government perspective. Here's why I want to bring parents into the room to talk about how they've partnered together and to help us to understand what real partnership looks like. And so there are going to be some areas where maybe leadership, you know, has to change, because in some ways it kind of comes from the top. You know, I can influence, hopefully, the culture at Children's Bureau, who can hopefully influence the culture in the regions around partnership. But then, you know, there could also be a disconnect once we get, you know, the farther we get away from, for example, me and what I can control, there could be a disconnect. I'm hoping that, you know, states will want to do this, want to understand partnership, want to learn from other jurisdictions, want to learn from the parents who are in their jurisdictions, who come to their, you know, their attention and say, yeah, listen, here's what we need, right? Because the pressure has to come, and I am using the word pressure carefully, from, you know, maybe from outside, but also from within. So from within the community. When I talk to young people and they ask me often, like, how they want to solve this problem or what should they do about this, I tell them, rise up. You know, rise up. You know, the civil rights movement was made of young people, and so I would say the same thing to parents when they're not getting what they want from the system leadership in their communities and jurisdictions.
We definitely are rising up, and we are empowered and encouraged by being able to have companies such as yourself and our willingness to organize and really raise the experiences and ask and demand, you know, that there be some justice and equity for families that have had too many years of inequitable treatment. Speaking of rising up, you know, I see a hand up over here. I'm going to call on Corey. So,
Sharonda, after Corey, there is a question in the chat as well. So after Corey goes, I just want to let you know, from Jessica Lloyd Rogers.
Thank you.
Is it okay to jump in there?
Yes.
Asia, how are you? So
Good. How are you?
I am well, thank you. A lot's been said, so I have two questions, and I know that my friends and colleagues have a bunch too, but you have called my attention and noticed that you have strategized with history, right? So that means we're not stuck in the past where we have to use this history in order to get to an emerging future. So a couple of things that I'll preface, I believe that if we don't rise up and if we're not careful and we're not recognizing that power is relational, we'll continue to ascribe power to those who sit in seats like yourself without ascribing power to those who've experienced systems of oppression. And that leads us to the up and coming Families First Prevention Services Act. If we're not really careful about making justice a through line, I believe we'll see more white children as candidates and more Black children that are being removed and taken into state custody. So that brings me to the question two. The first one is, we've heard this term, and what does transformation mean to you? Like, what does that mean? If you want me to give you both at one time or just the one?
No, let me answer that one because when I think of transformational change and transformation, I think of change that I think of, for example, when we're talking about the system that will turn, I think of 180 degrees, turning it on its head, something that's going to completely change the way, for example, families live their lives, families have access to the things that they need. The HUD rule that I mentioned has to really do with criminal justice. And the HUD vouchers, right? If you have a HUD voucher, one of the rules, and the rules are so archaic and old, it's not even funny, but one of the rules is that you can't have anybody in your home who has been to jail, been previously adjudicated, has had any basically, a kerfuffle with the law. And so how is that helping families when 136 million people in this country have an immediate family member who have been previously adjudicated? We know that with the mass incarceration, we know that it really impacts, Black and brown families more than others, right? The transformational change would be, get that out of there. What's that doing anyway? If I have a son and I'm living with a HUD voucher and my son is coming out of jail, and I have to tell him, oh no, you can't stay here. Where is he going to go? He's going to go to maybe a homeless shelter. He's still going to be living off the system. It makes no sense. So I use that as an example of something that would be transformational, that could impact 136 million families potentially in this country. I think about our kinship licensing. You've heard me say this before, Corey, because it's a real problem for me. That it's not. That we don't reimburse kinship families in the same way that we do, resource families, or some people would say, stranger families either. And I think constantly about Ma'Khia Bryant. I think about like her grandmother who tried to keep these children together, but, really couldn't afford to keep her family, couldn't afford to keep her apartment and keep the children together. And then Ma'Khia Bryant ends up somewhere else. And we know what happens with that. We've got to do better. That's something that's within the Children's Bureau's control. When I was taking care of my nephew's child, my grandnephew, there was no help for me. There was, public assistance, HRA, as we call it over here in New York, said, oh, just click this link. You can fill it out. Doesn't matter how much money you make. We're going to help you. And and I go, so what's the link? And click the link, and because his daycare was $1,200 a month. I would love some help. Great. I click on the link, and they're going to give me $400, but I got to take my own nephew to court for child support. No can do. Right? That's not helping him at all. But that's how the system was set up for me as someone, as a kinship guardian. So there's some transformation. I think of literally taking these inequitable policies that we know are out there. We were recently talking about TANF a couple of days ago, and just the racist history of TANF, and turning it on its head and making it completely different. And that's when I said, earlier, when I said, you have to use rules, you have to force it, because I can talk about it all day. Then when I leave here, maybe folks are still talking about it. Maybe folks aren't even talking about it, but I have to use the the protocols, the regulatory protocols that are in place to make the changes most of the time.
And well, wow. I mean, just, thank you for being human with us, right? And I think that that's critically important. So what I've heard is that it's a reinvention of self, right? A reinvention of organization, a reinvention of culture, and to see ourselves in that structure, within that structure, right? The last question for me, because I think I know the answer, but I want people, I want people to feel the answer here, Asia. So what risk? Because in reinvention, that means we got to challenge our core assumptions about even how the world works, recognizing that humanity for all people in these United States is a 57-year-old concept. 57 years old, legal humanity for all, right? Now,
right.
With that, what risk are you willing to take? You've chosen your hill, right? What risk are you willing to take to operationalize racial justice? It's not for just Black people, non-white people, right? For all.
I'll risk it all.
Sharonda, I'm done. I'm done. That's it right there. That's all I got. Thank you, Asia, for that.
Thank you so much for that. I appreciate you, Corey, as always. I'm going to pull some questions out of the chat. And I've got one from Jessica Lloyd Rogers. It says, can you talk about the necessity to partner with housing? Betting on the house is critical. Here in our state, lack of housing is a major contributor to delaying and preventing reunification. Bad housing, derelict, dangerous, etc. That has been a factor in separating children from their families. So I think her question really is around housing.
Yes, no, and you guys have brought up an analogy that I wasn't even thinking about actually when I wrote it. I was thinking about literally a gambling analogy, like going all in on the village, putting it all on the table for the village. But this analogy of the housing is really important. I wish I had thought of that actually, but listen, it's hugely important. When I was working in New York City, my most recent tour of duty at Administration for Children's Services, I was mostly external facing. I was really focused on our partnerships with our sister agencies, so Department of Education, Department of Homeless Services, and NYCHA, New York City Housing Authority, where we shared a lot of families. We had a lot of mutual families in NYCHA, but yet we didn't even talk to NYCHA. When I came in, I think November 2017, and I think in January, I asked somebody, okay, so how often do we meet with NYCHA? What are we talking about with NYCHA? I mean, you're talking about even from a prevention standpoint, like making sure that families have what they need before anybody has to call ACS or child protection. And folks were like, oh, we don't talk to NYCHA on a regular basis. And, to make a long story short, I said, well, let's begin to meet at least monthly with NYCHA. And, it took a little while to actually get the right folks to the table. And after we started talking monthly, we realized, wait a minute, we need to put this in writing. We need to figure out how we're going to work together to support families, whether they are impacted by ACS or not. And we need to put that in writing. And we began to, move toward an MOU. And we finally were able to get an MOU written. And so we have an official partnership with NYCHA. But I always felt like that was really important. It was really one of the things I'm most proud of in the 3 years that I was there, right? But if a family has no housing, like housing is just the main thing. I mean, I don't know, if any of us have been, without that before, even the threat of losing your housing, even think about the nervousness you have when you've got to move, but you don't even know where you're going to move to, whether you have the money to move or not. Like that is destabilizing, the very thought of that. And so I feel like housing has to be one of the top priorities and top partnerships when we're talking about making sure our not only our families, but our young people aging out. I'm looking at this now. I don't want to go on and on because I have so much on my mind, but one of the things that are on my mind are the pandemic flexibilities that we have extended for until September 30th. That include, a moratorium on young people aging out and some other things. And now September 30th is staring us in the face. And, I'm concerned about, the potential of young people who could be aging out and not necessarily have a permanent or stable living arrangement. And so what are we going to do about that? Well, you know what, I was talking to somebody over the weekend about this, and I was like, well, I'm glad, you know, someone was like, oh, are they going to tell people to go, you know, go to homeless shelters? Are they going to tell young people? And I said, I will never part my lips to tell a young person to go to a homeless shelter. I mean, even in New York City, we do not do that. But what I will do is be talking to HUD, you know, where, you know, let's figure it out what we need to do if it comes to that. And hopefully it won't, but we always have to be prepared. If it comes to that, what are we prepared to do to make sure that young people coming out of care are housed? So highly important.
And I think to your comments there, Commissioner, I mean, when we see people in desperate conditions, we then put them back in desperate conditions. And it doesn't make any sense. It doesn't help them to see that they can, you know, move through. We all need help. And if we don't get to that help, what we see are the consequences based on people that are in high stress and really feeling actually quite alone because there's no real supports put in place. I'm going to move to a question from April. And she says, the previous commissioner who spoke out to help to shine lights on issues within the child welfare, like racism and the negative effects of laws like AFSA. I would like to know, will you continue to work on putting out the true narratives of the child welfare system?
You know, the short answer is yes. The long answer is that, you know, when I wrote my remarks that I just shared with you all on Sunday evening, and yesterday I shared them with my senior advisors, and one of them said, you know, this is bold. She said, it's bold, it's making me nervous. I said, well, what about it, you know, makes you nervous? And she said, well, you're calling it like it is, you're saying this and that, which is really my nature, is to really, you know, sort of be a truth teller. And so she kind of goes down a little bit of a list, and I said, okay, but did I lie? And she sends the emoji, no lies detected. So it's important for me to be able to, in my position, you know, what am I here for if I'm not going to tell the truth? And yeah, it's going to be uncomfortable for folks. You know, it's going to be uncomfortable for my colleagues. You know, telling the truth doesn't make me uncomfortable, but it could be uncomfortable for some. But that's how you know you're growing. Those are called, you know, growing pains. When you feel discomfort, that means something is happening.
I like the getting people uncomfortable, and if you're comfortable, you're not growing. I'm thinking about our opportunities really about sharing that truth and the narratives from families that are actually living it. I'm curious just on, from your position, how are you bringing lived experience to your administration to share, you know, what people are experiencing in real time to help to shape how the administration moves forward?
Well, you know, besides the BPAC, we're like they're like my go-to. You know, I've been working with Think of Us, which is an organization that's run by Sixto Cancel. Some of you may know, but he is pulling together, and he and some other youth organizations are pulling together for me a continuous feedback loop for how I would get feedback, for example, from young people. We're using a couple of different modes, like we're using technology, which is a way to put out a question out there and actually get feedback from young people, you know, en masse. And we'll be using foster focus groups around particular questions if I have them, sort of digging in along those lines. We are going to do, and this is also, you know, a youth engagement strategy, but under my predecessor, there was a youth engagement team, what I call the first cohort of that. We want to do a second cohort that's really, you know, brings the youth experience more broadly within the Children's Bureau. I've also shared, and I think some of you may already know, that I'm leading the equity work for all of ACF. And so when, for example, the BPAC came to sort of, I call it the takeover, took over our equity advisory group meeting and started talking about the importance of including parents in our strategy and in how we, you know, whatever we intend to do, making sure that parents have an opportunity to co-design with us. You know, a couple of offices have already said, other ACF offices have said, oh, we're going to establish a group of parents in our office where we can go to continuously as we're starting to strategize around how we do this equity work and move it forward. And so we want to make it permanent within our offices. And that really just happened, like, you know, literally within a week after hearing from parents and hearing about the importance of, you know, what they can bring to the table. Offices started to say, how can we do that for our programs? You know, not necessarily Children's Bureau, but, you know, other programs. And so I have to, you know, I want to continuously talk to parents. I want to be accessible. Some people say I'm too accessible. I like being accessible. I like to know that parents can reach out to me, send an email, ask for a meeting, and they can expect to get it. I've met with some young parents who, that's been really interesting. Young people who have either been in care, had their children while they're in care, maybe they've aged out now and are raising young children, and you know, some of the challenges that they experience. And so I plan to always co-design with parents and seek, honestly, the counsel. As I said earlier, I have sought the counsel of the BPAC so many times that I'm scared to ask for another meeting, but really seek the input of parents in everything that I do.
I'm sure you're reaching out to the BPAC is always welcome. Proximity is essential, and it's comforting to know that you are getting to all folks that are having an experience. It looks like we've got a couple of questions out here. I believe Shauna has her hand raised.
I do, thank you. And as a member of the BPAC, I think it's like,
hi, Shauna.
Hello, we want to meet with you all the time as well. So I think it's just something that we have in common, and I think that's beautiful, and I think we should do it more. Anyways, so my question for you is that, you know, I a birth parent from Minnesota, and I work in the Native American community, and I can say about 97% of my clients are homeless. And we have a lot of tent cities here, and we have a lot of racial tension here. So a lot of people don't want to call police when things happen. So there's a lot of just unnecessary things that are happening that could have been protected. But a couple of years ago, I had gone to a meeting, and one of the things was the guidelines for federal housing. There was millions of dollars of untapped funding from federal housing programs that people in my state couldn't qualify for, because if they slept on somebody's couch, they didn't qualify for. If they slept in somebody's porch, you know what I mean? And it wasn't a sustainable space for them to reunify with their children, but it also didn't qualify for them to tap into funding from federal dollars. So I'm wondering what that looks like and if that's going to change, because 97% of my families are homeless, and they're not considered homeless under federal guidelines if they're sleeping on someone's couch. But that is not a safe space for them to be reunified. And what does that look like?
And it's not housing.
Right. And what does that look like? And how can we create a space where families can reunify, can qualify for programming? And I guess the qualification of what homelessness needs to be changed for me in Minnesota.
Yes. Was that HUD guidelines?
It was, you know what? I'm not sure if it was HUD, but it was Minnesota based. And it was definitely the difference between state and federal candidacy for homelessness. So I can tell you that when I try, I'm sorry to cut you off. When I apply for families to get any assistance, it's very hard if they have been, like, let's say we're staying with grandma, but they're sleeping on the floor and they have 3 kids that need to return home. They're not going to qualify to get any assistance for housing because they're staying with somebody.
But Shauna, is that Minnesota, is that a state guideline, or is it a federal guideline?
Federal. State's a little bit easier, but federal guidelines for homelessness is really bad. And it's really hard. The actual definition of homelessness and the untapped resources and dollars that we could actually use is really hard because of the definition of homelessness under federal guidelines.
Okay. I have a meeting next week. Let me look into what they are now. I mean, I know you said a couple of years ago. I don't know if it's changed yet, but thank you for bringing that to my attention.
Yeah, no, if you're staying on someone's couch, or you have a place that may be temporary for a week, you won't qualify for certain things.
Yeah, that's what in New York they call doubling or tripling up. And, really the city just sometimes uses it as an excuse to save money. Like, oh, you actually have a place to stay. We need to save, shelter housing for people who don't have a place to stay. But when you're sleeping on someone's floor or someone's couch, you don't have a place to stay. Exactly. And so let me look into that.
Yes. And then you can't be in the, county or the state's guidelines. You're not providing adequate home for reunification.
Right, exactly.
And that's a huge barrier that I see here in Minnesota in the Native community, because I'm saying about 97% of the clients that I work with would be considered homeless, but not under federal guidelines.
Thank you for that, Shauna.
I got it.
And I think you're talking about sense of stability and the importance of what that needs to look like in someone's life, and how we have these ideas that if you're sitting on a couch that you're stable. I can't imagine how unstable that is for someone. I'm going to go to a question that's in the chat. It's from Jessica Gregg. It says, my transformation question is specific to treatment and treatment access. I see significant need for trauma-informed care and trauma-specific treatment, as it seems everyone knows trauma, but not how to appropriately treat it. More than that, there is a significant need for increased access to that treatment through community mental health to underserved populations, but there is very limited funding for training or increased providers to meet that need. How can we advocate to train clinicians serving families to provide more effective and impactful services, as well as advocate for funding to provide that care to families involved in foster care?
Sharonda, can you read the first part of the last two sentences of what you just read? The first part of the question.
Yes. How can we advocate to train clinicians serving families to provide more effective and impactful services, as well as advocate for funding to provide that care to families involved with foster care?
I mean, the first thing I would think, is that you have to advocate. You have to pull your allies together, and again, that's sort of that rise up, that I was talking about earlier, and push. I know we've heard, in my role, like if someone would say, what are you going to do about it? I would say, what are your organizations? Who are you talking about? 1, 2, who are your allies? 3, have you all, requested a meeting, let's say, with the federal government, let's say with Children's Bureau, if that's the appropriate meeting? Have you written and said, hey, here's what we need. Here's what we're seeing in my jurisdiction, in my community. Here's what we need. Trauma-informed treatment. Here's what we wish we had, and here's what we had. So, part of it is really educating about what's happening. That's why Senator Killett says, organize. You have to press. You have to put the full press game on folks. And trust me, they've done that with me around Family First, for example. And it really does help, right? Because it helps me to be able to elevate certain things. So I would say you have to do that. With the funding, I don't know, the federal government would need to know, and we would listen, and we would, when we're able to be creative around our budget proposals and things like that, you may see something, come of it. But in your, usually those things really happen probably at the state level or even the local level, or even, we're talking about community-based organizations. But again, you have to press. I'm going to keep bringing up the BPAC, but one of the BPAC parents told me, that I think in Oregon, where there, for example, with substance abuse treatment, all of the money follows the mother. Whereas in his particular case, he needed treatment, and it was hard for him to get, because the facilities only had, they were only for mother and child facilities, for example, that sort of excluded fathers and their needs. So I think every area is probably going to be different, but I would certainly say, press and advocate and organize and write letters and have meetings and push.
Thank you. I'm going to actually lead into another question, and then Katie, I'm going to call on you next. But speaking of fathers, how are you going to achieve equity for fathers?
I mean, first of all, we have to make people understand and realize that we treat fathers inequitably. That's the number one thing, right? And in my role, I've already said and used my voice to say we need to treat fathers more equitably. Before I had to deliver some remarks at a particular event, and I asked them to meet with the BPAC fathers, because I wanted to hear from them, what their experience has been around, what was inequitable for them, what are some of the things that we need to do. So we have to keep highlighting it. There are some really good trainings out there. One that particularly comes out of California for social workers and caseworkers. And I did it. I did the training. I did a few hours of it. It's a full day training. I think I did half a day, where he's really digging into what are your biases of the fathers? What happens when the Black man with the tattoo walks in and he has some questions about his child who, child protection has been asking about, are you afraid of him? And what are in this particular training, it's really for the caseworkers to address their own biases. And I think that that's part of it too. Also, asking that question, if there's a child that might, is at risk of coming into care, have you looked for dad? Have you reached out to him? And in a lot of cases, and I don't know the stats, I wanted to say most, but I don't know that that's true. But in a lot of cases, they're not even looking for the father. They're not even looking for the father's. One of my friends told me one of my paternal aunts was an adoptive parent, and that she was 58 miles away, and they never even looked for her. So I think we have to continue to raise those issues, and I think fathers need to come together and be in everybody's face about how they're treated and how to turn that around.
Thank you for that. And I'll just add, I think that we certainly have to get some resources, dedicated resources to fathers. We have to really look at some of the punitive ways we come at fathers, child support, families that are in child welfare, how we attach child support. We know that Black and brown families are more likely going to be in child welfare. Then we have this punitive measure where we attach debt. We know that poverty becomes a hindrance in so many different ways. So there's so many, it just kind of continues levels down on how we attack our men, so that, it's difficult to kind of show up and want to be there.
Yeah, and Sharonda, if I can add, one of the things in New York City, a couple of years ago, the commissioner asked me to look into our policies around child support. And what we found was that when mothers were coming, for example, to HRA, to public assistance for help, let's say in most cases, custodial single moms were coming to the public assistance was requiring them to file a child support case against the father of their children. Otherwise, they would be sanctioned 25% of their public assistance. They wouldn't have access to Medicaid, would limit their access to child care vouchers and housing vouchers. This is all punishment if they didn't file a child support case against the father. And then what we realized is, one, the federal government doesn't require that. The federal government says do what's in the best interest of children. In New York State, the state reg said do what's in the best interest of children, as long as it's not physically or emotionally harmful to the parent or to the children. And so, I began to ask, well, this is where you have to do the partnership, working with my colleagues in HRA and the lawyers, right? Who I said, why are we doing this? Why are we forcing moms to, there's a billion reasons why you might not want to file a child support case against the non-custodial father. Some parents have, for example, we know at least 60% of our preventive moms have a history of domestic violence. One mother said to me, he's around, he comes by every Monday, Wednesday, and Friday and picks her up and spends time with her. I just know he doesn't have any money. I don't see what it's going to be, helpful for me to file a child support case. And I would rather him have a good relationship with his daughter. So there was a whole host of reasons. and that we didn't have to sort of convince the lawyers at Public Assistance to stop doing it and to use what we call in New York the good cause exemption that most women qualify for, so that they don't have to go into courts. And then when the pandemic hit, it became really important because the courts were closed and everybody had a need. So if that had been in place, we did eventually convince the lawyers. And I'll tell you, the way that I did it was I looked at one lawyer in the face and I said, if I took 25% of your paycheck, would that be okay? And she said, no. And I said, and if your kids needed a size 6 shoe, but they were wearing a size 5 shoe because, you know, public assistance wouldn't help, would that be okay? Would that emotionally harm you? And she said, yes. And she was in the lead. And that's how that whole thing got turned around. But then when the pandemic hit, it became important, right? Because courts closed. So that wasn't even an option. And yet still people have more needs than they had, you know, before.
I think you're bringing some great points of just what would you need, right? We need to ask those questions regularly. I'm gonna, Katie, I believe you have a question.
Thank you, Sharonda. I just, as we know, and as you mentioned in your talk, fear is such a major barrier to building relationships between parents and the people caring for them. And it's very systemic. Everyone fears these relationships. And so I would love to just hear your perspective on how do we not only call out this fear, but get folks to almost take a leap of faith and move past it to build the relationships.
You know, it's hard, Katie. I think in a lot of ways, it's an inside job. Fear is an inside job. You have to tackle that like within yourself. You know, when I was writing about it, you know, on Sunday, I was thinking about a particular thing that happened probably a month or so ago, where everyone's talking about authentic engagement. To me now, it's starting to sound like overused, but then we had to authentically engage parents. Okay, let's authentically engage. And they said, so we were all going to come together with some authentic parents and partners of mine, colleagues of mine, coming into the room and said, well, we got to get this. I'm calling her a mediator, but that's not what they called her. I can't remember. A facilitator. And so I said to the facilitator, like on the side chat to her, and I said, well, I don't need a facilitator to authentically engage. You know, that's to me, that's not authentic engagement if I need a facilitator. That's something you do, I mean, to me, but that's probably because I don't have fear, right? And so I don't necessarily, you know, need a mediator for me to get in a room full of parents, hear what they have to say, even if it hurts, right? But she said to me in private chat, she said, you don't need a facilitator, but others do. And so that's where that fear comes. You know, if we're addressing our fear, we don't need a facilitator to authentically engage with anybody, right? We can come to the table with our full selves, be ready to hear that stuff that we might not want to hear, that maybe we can do something about or whatever, because that's also part of the fear, right? It's like people who avoid arguing because they don't want to hear what they don't want to hear. But that's also part of growing, right? And getting somewhere. So Katie, some of it is internal. Some of it will be able to change for some people, like, you know, work through that, like, you know, have courage, be brave. Some people have heard me talk about courage, having courage in this role, courage my entire career. But you know, you have to, you know, kind of take a humane approach, look at us all as human beings and know we're not going to agree about everything. First of all, people on the system side, like me, we got to be able to hear that difficult stuff. We got to be able to take it on the chin. If you can't take it, really, you should get out the kitchen. My grandmother used to say, you can't take the heat, you got to get out the kitchen. But we already know that some people are going to stay in the kitchen and they have to address their fear then.
I have to tell you, I've learned something about fear. I'm over 50, so I'm going to say in my middle age. You know, fear lives in two places. You're either going to take something I have, or you have something that I want. And what I've learned is that we have to walk people through that. We have to let people know you lose nothing by giving, but you gain everything by being a part of something. And that, you know, that's that power piece, that power and control that the United States is kind of cemented on. And so we've got to continue to address that because we lose nothing by giving, absolutely nothing. I believe my friend and my love is out here, Kimberly Mays.
Thank you, Sharonda. Hello, Commissioner and everyone. I have a question going back to the child support piece. I was wondering do you know that when a parent's child is removed from child welfare, that they end up with a child support case for that kid being in foster care, and most parents don't even know they have a child support order because you might not get that mail. If you got the mail, you read it, and then it's still, your whole life's unraveled. So then you get a job, right? You're navigating through your dependency case. You get a job, you get a place to stay. You work for maybe a month, and then child support takes over half your check, every paycheck, because you're paying for your child being in foster care. So to me, just my finite mind, I'm thinking that's double dipping. Somebody's getting paid for my kid, and I have to pay for that. And so to me, it's an extra trauma to have your kid removed and then be forced to pay for your kid being removed. I mean, I know we all responsible parents, but they should wait until later when a parent is on point. That should not be happening. I mean, all my cases and most of my cases. And then this one mom seriously has been waiting 3 years to reunite. Her issues have been, not 3 years, 2 years to reunite, but she can't get housing because they will not drop that child support. No one can help her navigate that. It's ridiculous because she can't pay for both.
And you know what? I don't know what it's like in other jurisdictions, but in New York City, it only amounts to like $2 million. So what, we're bringing families through all of that for $2 million. That money would be better spent, in some other way. But yes, I know that exists. I know that it's a problem. When I was, just before I left New York, we were going to be looking into whether or not we could sort of turn up an exemption to that as well. So you have to get somebody to look closely at the laws in the state and make sure that they're just not, haphazardly requiring that when they don't need to. That's child support.
And forgive me, Commissioner, I had to go back as well. I was just waiting patiently. When we're talking about kinship and relative care and foster care, so are we doing anything about the fact that relatives like myself, the courts would place children with me, non-relatives, as a suitable adult, but because of my criminal and child welfare history, they refused to license me. And it took me 5.5 years to get to this level. And now I'm a licensed foster parent. But for 5 years, they would place 2-3 kids with me, sometimes 4. And I would get $300 for each kid unless there were siblings. So when there were siblings, I had 3 siblings, right? And now I got $400 some for almost $500 for 3 siblings. And I did an amazing job. These were youth who could not be placed anywhere else, busting, detention centers, all that. Now they're all in student foster care. They're straight A's in school. So I did a great job. Why did I have to go through all this to get why are kinship caregivers and or people like us not one get licensed, and or we're doing the same job, give us the same amount of support and money? It doesn't make any natural sense. If that money's for that child, why do I have to get less than a stranger or less than a foster parent and relative? We're doing the same thing. There should not be any difference in the rate of support.
I 100% agree, and I'm all over it, including the criminal background piece as well.
Thank you, Kimberly. Yes, it costs the same amount of money to put a kid in a kinship house, in my house, in your house. And we need to recognize that, if we really care about children, our investment is in making sure that they have all of their needs met, and understanding that our society as a whole has put an incredible amount of restriction and barriers on that unrealized dream for far too many people. So I echo that. I got some snaps there, my sister. I'm going to do one more question and then we're going to wrap it up. And this is from our father, Eddie Torres. He says, for fathers, I'd love to see recidivism addressed. Our prisons are very punitive and they're not very rehabilitative. Men go through a revolving door out of prison and then right back in. What can we do to address this so that people that get out of prison can be more successful? So many systems issues on this matter.
Yeah, but we criminalize people after they've done their time even. Whatever, let's say you do your crime, you do your time, whatever, we're still penalizing people. We still saying you can't vote, you can't do this, you can't get a housing voucher, you can't get a job, you can't get anything. All of that stuff has to be undone. that has to be untangled, right? And so, you know, I'm very sensitive actually to criminal justice issues. I feel like if I wasn't sitting here, I'd be somewhere doing criminal justice issues. So I'm sensitive to it where with respect to, you know, my families or the families that I serve in this role, but also just overall in general. And so again, that's another area where, organization helps, allies putting the pressure on systems that includes the federal government and any other system. But we have to stop, punishing. But, listen, you guys know what's going on in this country, right? What they wanted, their slavery ended, and then they needed a new form of it, right? The new Jim Crow, the mass incarceration. So every time, even the probation system, right? You come out, you got to be on probation. Oops. Oh, you're driving without a license. Oh, but you couldn't even get back in. There you go, back in jail and whatever. There's a method to that madness, and so you have to have people in positions of power, who want to change it, who care enough to change it, who can tackle it, and who can call it like it is. And so, there's a benefit. The country gets a benefit to continuously punishing those who have already been punished. And so that recidivism, that's I would argue that's by design. Get back in here and create these license plates and put out these fires or whatever it is you've been doing. And so we have got to stop and untangle and force them to change the rules around that.
Well, first of all, I just want to thank you for your time with us today. I'm just going to throw out a couple of concluding remarks myself and then open it up to you, Commissioner. I want to say that at the core of this is really just about people. People change people, people influence people, people impact people, and we create this divisive nature that there's something different. My need is your need, and your need should be my need. We need to be working in partnership of building the society back up, humanizing each individual, our homelessness, our child welfare, our penal systems, all are in a state of crisis. When you walk down the street and you see a child and a family sitting in a tent, we have done something horribly wrong. We have the money, we have the resources, we now need to prioritize. And the prioritization is really just in your fellow man. As I said earlier, you lose nothing by giving to another, you gain everything. So I want us to be back-centered into each other. Our work really is in building relationships, recognizing that each person may need some help along the way. My mama said, sometimes you need help and sometimes you need to get help. But at some point in life, you will find that you will be on one side of that pendulum. And so there is nothing wrong with asking or needing help. There's not a moral failing. We attach that to the individual rather than to the society. That is the distraction so that we don't have to do the work. If you make it about me, we don't have to talk about the situation here in the historical and environmental construct of the United States of America. Your work is not easy. You have an incredible group of allies here with a strong message and a strong experience. I hope that you will invite us to many, many tables. The power really is in those coming that you may have a story, but let me tell you my truth, so that you can have a new way of seeing the world around you and how I actually interact and how I've had to survive. I want to create an environment where each one of us thrive. When families thrive, our children thrive. And when our children thrive, our promise of this nation will be realized. They are our future. So I hope that you will take each one of us with you. We continue to want to build something that matters the most. And what matters the most to me is you. And I hope what matters the most to you is me. I'm going to ask you if you have any closing remarks as we exit out here.
Thank you so much, Sharonda, for that. And just 2 words, and then I'm signing off. In unity.
Thank you so much, Commissioner. All right, well, we are going to go into our next segment. I believe I will be turning it over to Shauna. Oh, before I go, let's give Commissioner, before you head out, I always love whenever you give, you got to get. So can we get some virtual love out here for our Commissioner, sending her out back into the world there. Thank you, thank you, thank you. I appreciate all of you guys. Now I'm going to turn it back over to Shauna.
Mazigadazi, Commissioner Schomburg, thank you in Hirata. Dosha, everybody meets Madaka Beho Bamia, meets Shauna King. My name is Holy Owl Woman. My English given name is Shauna King. And I just want to say hello. And I'm super excited. I'm very inspired after that last conversation and very humbled to be here today. I am a birth parent from Minnesota. I grew up in the foster care system, and then I became a part of the foster care system as an adult. So my children were involved in foster care. I am from Minnesota, and I'm also a member of the Birth Parent Foster Parent Partnership. And I am pleased to introduce to you today our next presentation. It will highlight new legislation in 2 different states, and it will feature a panel of foster parents and birth parents from those states. And now I would just love to turn the program over to Carol Edwards, who is the training director with the Youth Law Center's Quality Parenting Initiative. She will also introduce the panel and moderate the discussion. I'm looking forward to being a part of this panel and sharing some of my experiences from Minnesota. So Carol, it's on to you.
Thank you so much, Shauna. And first of all, let me just say that I am just inspired and motivated to continue advocacy for change in child welfare systems after the last speaker presentation. The dialogue was phenomenal, and I just feel so grateful that I was able to be a part of it. Just to listen in provided so much motivation. So thank you, all of you who shared comments verbally and in the chat, because I was enlightened by all of it. So today I'm very honored to be able to be in the same space with you and to share some innovative approaches to legislative changes that have occurred in 2 different states. We know that these changes were motivated by work that was already happening in the field. And so we give honor and we thank all of the parents and the staff who work together to make these changes possible. We have a very brief agenda for this time. What we'd like to do is to highlight new legislation in Florida and Minnesota. And we'd like to look at how our successful implementation of quality parenting initiative approaches really facilitates those parent partnerships that drove the legislative changes that we're going to talk about. And we'll share a few highlights about the legislation in Florida and in Minnesota. And we have a dynamic group of advocates who are going to share their experiences with us. I would like to introduce you to those who will be sharing this space today. We have 4 dynamic leaders in child welfare. We have Victoria Camper, who's a birth parent in Florida. We have Molly Clore, who is a foster and resource parent in Florida. We've got Darlene King, Darlene Bell, I went to Shauna, but it's Darlene Bell, who is a foster resource parent in Minnesota, and then Shauna King, who is a birth parent in Minnesota. So throughout the presentation, they will chime in, they will share their perspective. They will also share their involvement at driving the legislation, but also in motivating the change for it. So thank you to these 4 panelists for being with us today as we explore this whole concept. Now, when we talk about legislative changes, I just wanted to start out with just a brief introduction. Most of the time, legislation happens to mandate people to do something different. So the legislation is created to tell us what to do. But this was a very unique situation when we talk about the legislation that is really driving partnerships. This legislation happened based on the practices that were already occurring in the field. So foster and birth parents were already working collaboratively. They were already pushing the system to say, this is normal, this is what should be happening. And sometimes the system itself was really in the way of that change. And I can just recall personally of having foster parents tell me, hey, I'm getting together with this birth parent. I'm not telling the caseworker because I know it will create a problem and I will have to go through lots of red tape if I have to do that. So I remember those conversations, and I'm so excited that they kept pushing so that we could all change with them and we could just really catch up. All right, there's something else too that I want to point out. These legislative changes, I mean, parents were driving the change, but we also had, child welfare professionals who were aligned with that. So as a social worker, I always felt like, hey, I'm on the side with the parents because what they believed and what they were doing made sense. It was logical, it was natural, it was organic. And so that gave all of us an opportunity to be part of this change. So it was really about all working together. So it wasn't one group alone, but everyone worked to make those changes happen. And it's exciting to see something that develops from the field and results in legislation. Now, first, I'd like to do just a little brief overview of legislative changes in Florida. And for this section, Molly is going to help, and Vicki, they're both going to help us out with really taking what we know to be current legislation and giving life to it, sharing with us how did we get here. All right, so let's go to the first one. The new law in Florida is really relationship focused. So relationships drive this piece of legislation, and it takes into account what we know about attachment and stability. So in QPI, we know QPI is founded on developmental research, right? That really supports all the advocacy that we do. And so the new legislation recognizes the importance of attachment, and it takes relationships into account anytime we're looking at a move that might need to occur for a child. Now, I'm going to ask if we could have Vicki to share with us from her perspective why the relationship focused component of the new law is so important.
Well, the new Florida legislation now requires, upon removal of the child, requires a comfort call between the birth parent and the foster parent immediately after removal. So what that does is that's an opportunity for the birth parent to give the foster parent vital information for the child on what might be their most difficult night. And what it does most importantly is it sets a foundation, not only for their relationship, but it sets a foundation for a child-centered approach at the beginning of the case. And from there, a face-to-face introduction is made between the birth parent and the foster parent. So what that does is that gives an opportunity for the birth parent and the foster parent to come up with a plan so that the birth parent can attend things such as medical appointments, extracurricular activities, school events, and they can come up with a plan that works for them to do those things. It also not only supports the foster parent to supervise visitation, but actually participate in visitation. Because really, what is visitation? It's family time. And now what we have is this child has an extent, this is their family. So it gives an opportunity for the child to be able to spend that time with their family. And most importantly, it encourages a relationship between the foster parent and the birth parent after reunification and case closure. So one of the things that I do as an advocate for birth parents is I attend permanency staffings. And at that permanency staffing, the birth parent is asked, who is your village? Who is the person that if your child is sick and you need somebody to pick them up from school, but you can't leave work, who do you call? And I've been in those staffings where the birth parent has identified the foster parent and the case management say that's not good enough. And so as an advocate, I can say, and I have said, oh, no. Actually, legislation supports that relationship is good enough. And so it's amazing to be able to have these things in place, to be able to arm both foster parents and birth parents with this opportunity to be able to also advocate and empower themselves.
Thanks so much, Vicki. I mean, you just, brought the whole idea forward. And I know I noticed in the chat where people were saying, wow, I love this. I wish we could do more of this. And so I just wrote back to keep pushing to Jennifer, because, this is something that evolved over time. And we know that you cannot legislate relationships. You cannot mandate a relationship. So it has to occur by having interactions. We talked in the last section about trust, people being able to trust. And we know that we have to have trust to really eliminate fear. And so in this context, the relationships had to happen real naturally. And so now our legislation just supports those relationships. Okay, there's more. All right. So another part of the new legislation in Florida, really looks at giving caregivers more clarity around some of the expectations for partnership. And we talk about partnership plans and how we work together so that everyone is on the same page. One of the things that we found was that people didn't understand each other's responsibilities, expectations. And so oftentimes foster parents were being treated like a glorified babysitter, really not being given the full respect of parenting. Birth parents, the same thing, were left out of certain meetings and conversations, and this was about their own lives. And so this part of the legislation gives us an opportunity to really more clearly define expectations around caregivers and how caregivers can be more fully involved of everything that is impacting the child. So for this section, I'm going to call on Molly to jump in and share with us what this piece of our legislation really says to you as a foster parent.
Hey guys, so I am a former foster parent, but I still act as a resource parent to many children in my community who were fortunate to be reunified, but continue to come over to my home on a regular basis and are just part of my extended family. In addition, I'm the Foster Family Support Program Director for the 13 county area in North Florida. So I have the honor of leading a team made up of foster parents, former foster parents, adoptive parents, birth parents, foster alum, kinship caregivers, and a whole bunch of really smart social workers. And we love the partnership plan. When I was a foster parent, I hated the partnership plan. I thought it was another form that they wanted me to sign, and it was kind of like a one-way contract. So the foster parent had to do all these things, but nobody else was bound to anything else. And I didn't really feel like it was child-centered. It was really, what can we get the foster parent to do for us? But then as I got into this work and I started really analyzing it, I thought, no, wait, we can use this to improve relationships between birth parents and foster parents, improve relationships between our system partners, so the professionals like case management and therapeutic providers, to really better meet the needs of our children. So I had the opportunity to speak before the legislature, I guess it was last year before the bill was passed, to talk about how important it was to utilize both lived experience and prioritize partnership between birth parents, foster parents, and system partners as a whole. And so that brings us to this form, right? And Carol just cringed because I said form, but it's only as good as relationships that are built around it, right? So with this, right, we're mutual parties are making a loving commitment to the child and their well-being. I'm very excited because with this new legislation, there's funding tied to it that helps us tier our foster parents and scaffold their training to be able to better meet the developmental needs and the needs associated with the various kinds of trauma that the children may have experienced. In addition, it talks about a higher level of care with supervision and discipline. So every one of the CVCs, and that's in Florida, we're privatized, every one of the CVCs in the state of Florida will have paid staff of a TBRI practitioner. So trust-based relationship interventionist. If you're not familiar with that, search it, because That's fantastic. In addition, there's a renewed awareness, enhanced focus on making sure that we are involving the child within their community. So one of the things that the legislation brought forward, and with the Families First Prevention Services Act, was our Family Finder program. So when children come into out-of-home care, immediately someone on my team is making every effort to try to find relatives and non-relatives for these children. And many times the foster parent is at the helm, right? So we have them at the table with the birth parent trying to find relatives and non-relatives. And then ultimately it's a commitment to enable the child to have a normal life, right? We're expanding their family unit with the partnership plan. We're not choosing one family unit over the other. And that was a passion of mine when I started as a foster parent in 2015. And I'm so excited that the state has recognized the value of it. So.
Thanks, Molly. Thank you for sharing that. It really just kind of brings it forward. And you talked about how important it is that, you know, that there is this not one side relationship that's being built, but it has to go in both directions. And in fact, in all directions, because folks in the system have to be willing to support those relationships, because they can support the relationships, they can undermine the relationships, but everybody has to be on that same page. There's one final slide on Florida and some of the legislative changes. And this particular part of the new legislation focuses on everyone supporting those relationships between caregivers and birth or legal parents. And so this defines how do we support those relationships. Talking about telephone communication, in-person meetings that might occur, making sure that everyone is aware, everyone can get to the table, really looking at mutually developed plans. Of course, being involved in conversations around transitions and including everyone in making sure that children feel supported, nurtured, loved, and cared for. So that's Florida. That's a very high level overview of the changes in Florida. But now let's flip to Minnesota, because Minnesota made a really significant change in the work they were doing. So let's look at Minnesota in terms of comfort calls. Minnesota legislation really took a huge step in making sure that comfort calls were based on QPI Minnesota core values. And so you'll see some of those values here, but primarily we're talking about how comfort calls facilitate relationships and help us to take better care of children. So for this one, I'm going to ask on one of our Minnesota panelists, Darlene, if you would chime in on this one and share your perspective of this change. Darlene, unmute.
All right.
There you go.
Well, thank you, Carol, and thank you, everyone. My name is Darlene Bell. I'm a foster parent from Minnesota. I'm also a QPI champion. I am on the steering committee, QPI Minnesota steering committee. I am also
Darlene, it looks like Darlene's a little frozen at the moment.
Yeah.
Okay. We'll come back to Darlene. Is everybody seeing that Darlene's a little frozen? Okay, so it's not just me. Okay, so we'll trust that she will chime back in. But for that piece, let's just go back just a little bit. Okay, so for that piece, and then I'm going to ask Shauna, feel free if you want to jump in on this part too. But this one, you know, really looking at comfort calls, and we're working on comfort calls as well in Florida, but it's important to know, I think at the very beginning, when Jennifer Rodriguez was introducing QPI, talked about Pasquale's involvement in really bringing this to the forefront and being a huge part of national change around this area of comfort calls. Shauna, did you want to chime in and say anything about comfort calls here?
Sure, I thank you for that. I truly think that that what me and Darlene were going to talk about was pretty much on the same level. So I am a huge fan of Pascal. Gave me this necklace here, and she is a part of my team, and I just love her. I think when we talk about comfort calls, and so let me just go back to something. One of the things that I think about QPI is about relationship building. And when I first came to the birth parent foster parent partnership, when it first started, I was asked to talk about what that would mean to Native American families. And when we talk about indigenous culture, we always like, I don't know, every tribe you're from, we usually have something that is a circle. Everything revolves around a circle. And when we have a family unit, it's a circle. And in having those spaces that are, you know, kind of have a lot of trauma, historical and generational, and we involve foster families, we're thinking about expanding that circle so that foster families are just involved in our family circle. And I think that's super important. I think that needs to be relevant as far as relationship building between birth parent and foster parents. Both Darlene and I were able to advocate at Minnesota State Capitol for comfort calls and speak on that. And I think it's funny because one of the things that they had afterwards was the extra paperwork. One of the things that one of the counties was complaining about Minnesota was the extra paperwork that they had to fill out for ICWA cases. And then we wanted comfort calls. So I just thought that was kind of funny, but I think it's in best practices. One of the things that we were able to do with QPI was bring comfort calls and the idea to it to ICWA prior to it going to this space where we were talking about it at the Capitol. So QPI was invited to ICWA cabinet meetings, which we hold every Friday in the ICWA Law Center office, which I work at. In those calls involve all of the ICWA judges, all of the ICWA county attorneys, all the garden ad litem's, and anybody working in the ICWA community aside from social workers. And they loved it. I didn't hear one person say, oh no, too much work for me. Can't do this, no. They loved it. They're like, this is best practices. Let's do it. Let's have this happen. So the fact that it was passed in November of 2020 was awesome. So I haven't particularly had a mom or a dad who had this happen, but I have heard of this in ICWA cabinets. And the fact that families are able to have that sense of peace of mind before they work on their case plan, that their children is not going to be stolen, that they have somebody that's supporting them, and that they have somebody that their child can be safe with, is so important for a birth parent to move forward in their case plan. So they're not stressing about, where's my child? Does this person want to steal my child? What's my child eating? Do they know how to fix their hair? What's going to happen? Is such a relief for families that they can just work on now what they need to do to move forward. I guess that's like all I have to say about that, but I'm very happy that it's implemented in here. A couple years ago, Minnesota was represented, and I remember them talking about comfort calls being implemented in certain counties, and I raised my hand and I'm like, how can we do that in Minnesota in the courts? And now we're doing it. So it's amazing and it's awesome. Thank you.
Shauna,
thank you, Shauna.
Yeah, I was gonna say, Shauna, thank you so much. Carissa just texted me like, yep, you are rocking it. I cannot believe that as I was speaking, it completely froze. On my end, it didn't look like it was froze. So I just kept on talking until my computer just shut down. So thank you so much for covering it. Thank you. And Brandy, and Carol, when you introduced us, you said Darlene King. You already knew that there was going to need to be a link between Darlene
it's
Bell
okay.
and Darlene King.
Darlene is all good. So
Have you?
have ever seen Darlene and I present before. You know what? She's always like, I wish you would have been my foster child. I'm like, I wish you would have been my foster mom. You know,
there's a lot of love on this call.
There really
Thank
is.
you, Shauna.
Thank you.
Well, Darlene, you're still totally in this, because we're going to go ahead and move to a few panel questions. So when Shauna was speaking, she really did go into a little bit more detail, but this particular slide is really just reinforcing how the process happens of the comfort call in the Minnesota state statutes. So it goes in here and it just talks about how that process happens. Just gives a little more detail, but we're going to go ahead and move to the panel questions. All right, so we have a discussion planned, and I'm excited to kick off this conversation. We're going to actually be kicking off our first question with Molly, but for all of our panelists, they're each going to take a minute or so to just kind of share their perspective. But based on these legislative changes that happened, which some people did not believe were possible, did not see how we would ever get there. So what's your impression of these changes? And more importantly, how have parents been involved in achieving these legal changes that we've just reviewed? And I'll kick it off with Molly for that one.
Thank you, Carol. Well, for us, it started out as a grassroots movement. So years ago, when I first got licensed, one of the employees for the community-based care agency that I worked for said, hey, you're really good at partnering, and they're looking for some foster parents to go to Seattle. You should try that. And I was like, okay, well, I'll apply. It didn't seem like I was doing anything that wasn't the norm. My friends and I got into fostering to help make our community a better place. And we definitely did not want to end up driving a 12-passenger transit van. So we were like, how can we get these kids home, and how can we improve the community that we grew up in? And then we started realizing that that wasn't necessarily the norm. And then it made things really messy and complicated, according to the social workers. And so I go to Seattle and I learn some ideas, and I come back and we start talking at our dinner table. And we're bringing our birth parents to our dinner tables. And next thing you know, we're running the volunteer Tallahassee Area Foster and Adoptive Parent Association. And the leadership of the local CBC, Community-Based Care Agency, said, wait a minute, you've got your hands with all these foster parents, and I need more foster parents. You want to come work for me? So I did. And we hired foster parents and adoptive parents and birth parents, like I said earlier. And foster alum. And I truly believe that's how our voice was heard. We have prioritized hiring individuals with lived experience. So we have well-rounded views when we come to the table. We know what we're talking about, right? Because we've lived it. And we normalized it, right? And so then what we found was the sister CBCs were paying attention, and they said, wait a minute, you have foster families and you have places to put children, and your foster parents are taking more children after children go home. Maybe this works. And so, and then one day I got a call that said, you want to come talk to the legislature, because what you're doing is really interesting. And then I think all of that, but really QPI and the relationships that were sustained, started all those years ago, are what made us achieve these legislative changes. So.
Awesome. Thanks, Molly. Victoria, or Vicky, it's more affectionate. So what's your take on it? How have you seen parents be involved in really pushing this legislation forward?
Well, one of the things that I do locally is I chair a birth parent advisory board. We call it a family engagement advisory board. And the last face-to-face convening in Seattle was the first one that I had attended. And at the end of the convening, we were instructed to write a letter to ourselves. And I wrote a letter saying like what my intentions were going to be from what I learned. And the letter I wrote to myself is that I wanted to partner with the foster parent mentor in my area. And it was so funny, because by the time I got that letter, I had not only partnered with her, I'd gotten to know her, but she had actually, so what the funny thing is about our birth parent advisory board is every time I talk about our birth parent advisory board, I always say it like that. It's a birth parent advisory board, even though it's called the Family Engagement Advisory Board. But I always feel like on a state level and a national level, I have to explain what it is. And I will tell you that once I partnered with our foster parent mentor, and she became a member of the Family Engagement Advisory Board, it totally made sense that it's not a birth parent advisory, it is a family engagement advisory board. And so her attendance at that really made it make sense it's about the family. Mm-hmm. And so on our family engagement advisory board, what we've done is, so I'm a member of the QPI steering committee in our area. And so what I've done right around the same time is I started making it an agenda item on our board meeting. So it's a board of me and 10 other birth parents that make formal recommendations to the department to change policies. And so we started talking about comfort calls. And so our birth parents had the opportunity to give testimony to the department on how they believe a comfort call could have potentially made a positive impact, not only on the relationship with those birth parents that had a relationship with the foster parent, but also the birth parents that had a relationship with the relative caregiver. And they said this could have made a difference early on in the beginning of my relationship with my relative even. And so from there, we were able to start doing, before it became legislation in our area, we were able to start implementing comfort calls. And so our birth parents not only were able to make recommendations for that, they also were able to participate in creating the training for the investigators who facilitate that call. And also I've been able to have the opportunity to sit on the calls once for the policies to be created and be able to bring, as one birth parent, I only have a perspective of one birth parent. Mm-hmm. Like I can't represent all birth parents, but I have been able to sit at these committees to create policies where I'm armed with these 20 testimonials that I got from birth parents about their own story on how it could have made change, just so I can give policymakers an opportunity to hear those things. Like if they ever wondered if birth parents really want comfort calls, I know 20 of them that do, and this is what they say about them.
Wow. So, Vicki, I mean, I can't even like put it all together, but just what you're saying is so impactful. And so as you're describing some of the work that you're doing, I wanted you to like finish your thought with what you were saying, but it's just so impressive about how, because the main thing that I'm hearing from you is that you were at the table. Like sometimes you had to create a space. Sometimes you weren't invited to be there, but you created it, right? So that you were there.
That's true. Yeah, that's true. Sometimes, yeah, I wedding crash committee meetings. I do that, Carol.
Hey, whatever it takes. But thank you for sharing those examples, really specific examples. What about Shauna? Shauna, so when you think about how parents have sort of led the charge for this, what in your experience would you like to share?
So for me, when I was first invited to the table, being somebody who aged out of foster care and then somebody who was involved as a birth parent and had their child in foster care, I was like, really don't think that I trust foster parents. I never had experience being a parent mentor with families who had good experiences with their foster parents. And then the more I learned and the more I grew and the more I understood, I probably can't even sit on a panel and talk about things without even crying about what difference QPI would have made in my life as a foster child. What a difference it would have made for my mom. What a difference it would have made for my foster parents, and what relationships I still could have with people in my life that the state never really addressed or, gave any relevance to. It was just, do you have a roof over your head? Good, that's fine, we're done. You know what I mean? We don't have to worry about you anymore. So for me, when I think about these things, I think about that. I think about how impactful it could have been for me as a child in foster care, and how impactful it could have been for me with having my children in foster care. I think that parents, when they talk about these things and they talk about how hard it is for them to fight, not only the county or the state, but also foster families for their own children, is hard to listen to and hard to hear, because they're also dealing with their own traumas that brought them into the system in the first place. And we all know, once you come into a system, you not only have to address whatever brought you into there, you have to address whatever the state wants you to address as well. And you have to do it by their guidelines, not by yours. So being able to have comfort calls where a foster family can say, hey, listen, I'm here, and I'm here just to, care for your child. I'm hoping, for reunification. I just want to know, I just want you to know I support you. What does your child like to eat? How do they like to have their hair? When is their birthday? How do they sleep? What makes them fall asleep? What don't they like? What do they like? What is their securities? What are their insecurities? What time do they wake up? Those types of things that you do and you don't even think about as a parent, that can be addressed in a comfort call, is so important. And it gives that family, like I said before, a peace of mind so that they can move forward in dealing with whatever brought them into the system in the first place, whether it be chemical dependency, mental health, or whatever they need to do to reunify with their children. I think it's just much easier space to do when you already know that your children are being provided the love and the care and the support that they need. And I think if my mom would have had that as a mom, birth parent, when I was in foster care, maybe things would have turned out differently for us. And I might not have came into the system myself as an adult. So I really think that listening to birth parents and having them talk about what it is that is holding them back from trusting a foster parent, and addressing those issues, and talking to the people who are in power, which is the judges and the county attorneys or the state attorneys and the foster parents, and saying, this is something that they're really dealing with. How can we address that?
That's excellent. Thank you, Shauna. When you were just talking, so many things were going through my mind. And, I thought about we talked about family in terminology. And I thought, I've never been a foster parent or an adoptive parent, but I'm part of a co-parenting community. I have 15 godchildren, and I'm preparing for one of them to be with us for a week. And I was just thinking about all of the preparation that is happening to make sure that this child feels secure and safe while her parents are away, and how it feels so natural, and how some of the processes that we do within the child welfare system are so unnatural. And so I'm so excited to see some of these changes starting to happen because it's what you do for our own children or for any other child, that every child really deserves that. All right. I'll get off my soapbox and go to Darlene, and I'll tell you guys. So for those of you that are looking at time, we have about 5 minutes left. So that's a heads up to our panelists as well. But what you did so beautifully is you combined question 1 and 2 together. So we are in good shape. So Darlene's going to wrap up this one, and then we'll just have a minute or so to finish up that last question.
Well, I hope this doesn't freeze this time. And I just want to just reiterate, everything that the panelists have already said. One of the amazing things also that happened here in Minnesota was we had a reunification day proclamation by Governor Walz last year. And that was just amazing. And, Shauna, you so eloquently talked about the difference that it would have made if we'd have had QPI then. I just want to fast forward and just say it is so amazing that we have the laws and the policies that have been changed here, because now look at what we call normalcy for children. Look at what's so not normal the past 18 months that we've had a pandemic. These kids, our biological kids are in one bucket, but you think about these kids who are out of home placement. Visits didn't happen. They didn't have school. They weren't able to be with their friends. And it was just limited activities that they had. But because this comfort call piece was already in place, already passed, that had helped build the foundation and lay the foundation to just fill that gap between the foster parent and the bio parent, that we could then connect on Zoom calls, that we could do Skype calls. So I just want to just wrap that piece up and just say, I feel like it just paid it forward to where we are today with the comfort call.
Thank you so much, Darlene. And you guys know what? We had a great question that came into play. A question was around, what was the reception from the general community, or, you know, from staff in general about these changes? So were they receptive? Were there barriers? Were there resistance? And how did that get addressed? So any of our panelists want to comment on that? Shauna.
Yes. So some of the barriers that when we brought things up was a cultural component. And I think when I work with the Indigenous community and within ICWA, there were a lot of things that weren't addressed with QPI. And I think that piece was severely missing. One of the wonderful things was that QPI and the Youth Law Center were so receptive to that they were open to having a webinar around cultural components and what it's like and how do we keep that when having Native American foster children in your home. So for them, listening to me as a birth parent coming into a space, not being somebody who had, you know, all of the degrees and stuff behind me, which let me say birth parents do have that as well, but I don't. For them to understand what that meant and what that meant to the families that we're working with and how that was a barrier in my community was very important. And so I was able to plan a webinar where I was able to pick the speakers, the subject, and we were able to have a whole webinar based around a cultural component of Native American children being in foster care. And I thought that was wonderful and beautiful and much needed. It's sort of missing when we talk about QPI, and I know that is on the that is changing. So that was one thing that I think happened and was wonderful and beautiful, and I believe it is on the website that you guys can watch.
Thank you, Shauna. And just to add on to what Shauna was saying, I'll share from the perspective of staff, is because that's sometimes where we might expect resistance, that staff who work in agencies might be resistant. I've been part of a lot of systems change in agencies, and resistance is kind of a normal process of growth and development. But I would also bring to the table that for many people who go into this field for the right reasons, this is a welcome change. Like, I felt like reborn in child welfare when it happened, because I felt like previous practice was not aligned with my core values as a social worker. So these changes gave me a place to take those values and to be able to express that part of who I was. So it helped me to get freed from some of the systems barriers as well. So those of us who were like-minded, we were so eager about the changes. And for us, it made it a much better work environment as well. So our panelists, they did it in their own way, but responded to all of the things that we had set before you. And Shauna did a beautiful job talking about the training she did. Some of the other implementation things that I know have happened that the panelists have shared with me is being able to co-facilitate with any kind of pre-service training that you have, getting in there early, making sure people are hearing it. Really working on any kind of subcommittees and task force, writing, really communicating with everyone about the changes that have happened. So I want to end by thanking the foster, adoptive, parents, the birth parents, staff, leaders, the entire family of concerned and loving caregivers for supporting some of the changes that have happened. And just as a reminder, even though you might not be in a QPI site, I hope that some of the changes you heard, you're reminded that you can implement some of those changes, whether you're a QPI site or not. So there's been amazing work done, and I just thank you guys for letting me share the space with you.
Thank you, Carol, and thank you to the great panelists. We so appreciate the presentation. Was absolutely fabulous, and we certainly appreciated all those words of wisdom and learning more about comfort calls and just the innovative legislation that is happening right now in Florida and Minnesota. So now I want to take everybody to a 10-minute break. I'm sure you're all ready to stretch a little bit, but please remember to come back when you...
It makes a huge difference. And just being at FDMs and supporting them, you know, giving them, you know, when they go and see their parents at an FDM or something and the resource parent has the child, you know, saying, you know, here's your mom, you know, here's your dad. And just, you know, making sure that we watch the language, right? So we just want to make it as strength-based as possible. Just, you know, doing some research on, you know, on what addiction is and mental health and DV is always, you know, important. And just questions along that line. And so those are kind of the things that the birth parents talk about, you know, just recognizing that they're doing well, and also just helping them feel like a parent, you know. When their child was removed, that is just the worst, you know, traumatic day of our lives, right? And so, and then we get an hour a week, right, for visitation. So the rest of the time, we're just wondering what they're doing. So anything to, you know, strengthen the parent and let them know that they're still inclusive as their parent.
Thanks, Belinda. One of the birth parent stories that I found really impactful was one of our parent mentors, Danielle, shared that when she had communication from the foster parent about her child, like just like hearing that person's voice, seeing their face, relieved so much pressure for her, right? And allowed her to shift from worrying about her daughter to being able to focus on the changes that she needed to make, and to be able to focus on her treatment and being able to move forward. And just that piece, I think, can be so impactful for birth parents, right? Like understanding that there is a person who cares and who's going to communicate with you, so that they can let go of that worry about, you know, is their child safe?
And also, so we talk a lot about communication, that being the most important topic really that comes up. And I think this is, you know, aligned with the BFPP tools as far as strengthening the relationship and having that long lasting relationship, asking questions and whatnot. I think we do a lot of that. You know, and some of the communication practices can be, you know, just remembering that the birth parents are coming in here, and a lot of birth parents have, you know, this fear or this, you know, of the authoritative figure, that they're not really going to communicate with them or, you know, just engage with them. And so when they're coming into the system, usually the resource parents, depending on their own history, right, of child welfare when they were growing up, they may see the resource parent not as having that power because they have their kid, right? And so they think that the foster parent is wanting to take their child, not realizing that child welfare is the one that, you know, has removed their child. And so a lot of what we do in our program is we have parent mentors that are able to kind of help them navigate that and build those bridges. So just recognizing that and just kind of just being able to talk to the birth parents and reassure them that, you know, that you're there just to take care of their kid, and you want to know about their cultural beliefs, their values, religious, ethnicity, where they came from, you know, just any little thing that helps. I mean, you know, if a child is afraid of heights and they go somewhere, you know, just knowing how to handle a child that maybe has an anxiety attack or whatnot. I think co-parenting is super important. We talk about this, you know, and this is like inviting the child, or inviting the birth parent, sorry, when the child maybe has their first haircut, and I know that they have to ask the caseworker, but maybe inviting the parent to go to that moment where they're getting their first haircut. I mean, it's a big deal, you know, and so that's important too. Sending a card, disposable cameras are great. You know, sending it back and forth and then developing them, their dislikes, their fears, you know, just wanting to be a healthy parent, and having that resource parent being able to help them and show them how to be that healthy parent, and then have that relationship. You know, communication can start as little, I say, as like a Post-it note that, you know, they send with the visit, or a journal, or email, and then it can be as, you know, having dinner over at the resource parent's house. A lot of our mentors have relationships with their resource parents that are very long lasting. They go to birthday parties, and I think it's just great for the child, right? So the child gets to see that these parents, that their parent and the foster parents are coming together, and how beautiful is that for the child to watch.
Thank you, Belinda. So at the end of our panel presentation, we typically try to leave folks with a handful of takeaways that are sort of easily memorable. And so these are the 5 takeaways, you know, that communication is really, really key. Asking foster parents to really engage with parents and communicating about things like visits and having regular contact, using a lot of the tools that are mentioned in the BFPP guide, scrapbooks, exchanging photos, looping parents in about things like school and IEP meetings and medical and dental appointments, of course. The second takeaway really being about transitions, that there is pain and trauma involved in the separation of kids from their parents, no matter what the situation was at home before they were removed, and just being super intentional about anything we can do to ease pain and trauma for the child and the parent during that traumatic separation, and also being intentional, planning towards reunification. Small acts have big impact. You know, one of the things that often will come up with parents and birth parents in our panels is around making sure that children have their special belongings, right? Like a blanket or a toy. Just those tiny things can be so meaningful for kids, and for a parent to know that they got their nubby or they got their stuffy, right? Means a lot to them. Working as a team, you know, taking a collaborative approach, reminding folks that, you know, the caseworker, the foster parent, and the parent and other providers can all be working together to wrap around and be supportive to the whole family, right? And that we don't need to have this sort of artificial separation of parents and foster parents. And the final one, just really being around hope. So many parents have expressed that having one person, when they're in child welfare involved, express confidence in their ability to do what's being asked of them, and expressing hope in them was so impactful. And resource parents can be the folks who are sending that message, right? They can tell the parent that they believe that they can change. And so I think in these really successful partnerships that we're seeing, that really is a theme, that curiosity about the birth parent's experience, and then making it really clear as a resource parent that you do hold hope for the parent's ability to change. Last but certainly not least, you know, this is equity work, right? Like it took some work for us to get here. The status quo isn't good enough. We need to both continue these dialogues and push the kinds of topics that Commissioner Schoenberg was talking about this morning. That was so inspiring. So it's super normal in these panels for a lot of the very authentic questions that come from the foster parent audience to highlight, you know, the biases and stigmas that still exist about child welfare involved parents, particularly parents with substance use disorder. And so part of the work that we try to do is just really call that out and correct those kind of stigmas and assumptions when we hear them. And we also try to make it really clear that foster parents, hold a certain amount of power in the child welfare system, while also acknowledging that there are plenty of ways that foster parents also feel sort of ignored within the child welfare system. So we're trying to encourage child welfare leadership to continue in Oregon, including parent partners, parent mentors, and people with lived experience on any training work groups and any child welfare work groups that are working on family engagement related issues. And I think we're trying to also move the needle a little bit on expecting child welfare leadership to set expectations for the child welfare workforce and the way that they work with families. And just acknowledging that there are still really oppressive case practices out there, and this fear that sort of is allowed to drive separation between parents and foster parents is an oppressive practice, right? Like letting that drive the case plan is not okay. And so we really see this training work as something that is helping to hopefully dismantle those practices. I think that's all that we have. So I'd love to open it up for questions or comments.
Thank you both very, very much. I have two things that I would like to offer. And one of them is that it's so important for birth parents to realize that as afraid as they are of resource parents are just as afraid of them. Mm-hmm. It's the unknown. It's a natural thing. And so just knowing that might help. The other thing is something that I got from Dr. Crumbly, who I'd never heard of before, but who is amazing. He's on the East Coast. He's retired officially, but he's done a ton of work with birth and resource parents. And one of the things he said in this training I thought was so profound in terms of acknowledging the power that the birth parent has. That is the birth parent. And he said, it's so important to ask the question, what do you want me to tell your child about why that child is staying with me? Mm-hmm. Such a simple, amazingly powerful question. I have passed that question on multiple times since taking the training. And I took the training like 3 weeks ago. And I've already probably told 10 people that I thought this was an amazingly impactful question. So I think those are the two things that I want folks to know is they're just as afraid of you as you are of them. and for resource parents, ask that question. You know what the agency said, why they're in care. That may not be what they want to say. They may want to say mama's sick and she needs to go get help, which is often enough. So I just want to encourage that. And the 5 takeaways, we have a comment in here that those 5 takeaways can be used every day. And another huge attaboy for Dr. Crumbly. That he's fantastic. It was new to me. I didn't know he's apparently been doing this awesome work for many years.
Jessica, there is a question in there from Jessica Gregg saying, is this also incorporated into the recruitment process for foster resource parents to set the precedent even before the training? Great question. That's from Jessica Gregg. I don't know, Linda May or Belinda, if you want to respond there.
I mean, Jessica would probably know the answer to that better. She probably knows a lot more about how foster parents are recruited than we do.
I can tell you that under our leadership, which we were lucky enough to get from Maryland, and they're amazing. Yes, they have made that expectation, and it's rattling some cages because it's different. It's a change. Change is hard. But the other thing is, and I hate to use this analogy since I've been married 12 years, but honestly, all the women and probably everybody, you got to get rid of the bad partner to make room for a good partner. I mean, that's just reality. And if you keep hanging on to the bad partner, you'll never have room for the good partner. And the same goes with this kind of and I hate to bring it down to that level, but honestly, that's what we're talking about, people in relationships and interaction. And so when we set a higher standard and a more inclusive standard, which is what our leadership has done, it means that we get more appropriate, helpful, inclusive, accepting, and partnering resource parents. And that's good for everybody. So yes, and as I said, it is rattling some cages because it's not how it used to be. And we all know the system was broken. I saw another comment or question in here that I'm looking for.
Jessica, we do have a question from Timothy Phipps. He's got his hand up.
Okay, Timothy, go ahead.
Thanks, Jessica. I'll go ahead and go on while you look for that one in the chat. So I appreciate, excuse me. I appreciate some of the conversations we've had about comfort calls prior to your presentation, Linda May and Belinda. And I know that through your advocacy, child welfare leadership in the state is moving towards making that part of the practice. I also know that there are some parents in the trainings that talk about journaling. And I haven't heard that on this call yet. So I'm wondering if you would sort of speak to what that piece about journaling and what some of the perceived benefits of that are.
Belinda, do you want to speak to that?
Yeah. So a lot of times the resource parent will have a journal, just a little spiral notebook or whatever. And they're able to kind of pass that along during visit. So it would go with the child and then the parent will be able to have it. And in that, the resource parent can write in their, questions that they have about the parent or the child. And then the birth parent is able to write things back. And they do leave time during the visit, the safety service provider or the SSA that's there, they do leave time for them to do that. We'll write back, what is my child doing? How is he doing in school? Just questions. And then the resource parent will, the next time, will answer those questions. So it's really important when, parents only have that 1 hour visit most of the time a week, they're wondering what they're doing the rest of the time. And so this journal provides an opportunity for them to kind of see what they're doing, see their world right now. And that comforts the parent very much so. And then they don't feel so afraid, right? Afraid of their child being taken away as well. And that's starting to develop that relationship. So it's a huge tool, a great tool to have. And a lot of parents and resource parents, they use that. And it's just a form of communication.
Can I jump in here with a story that I was told that I think is so important? When I talk to resource parents, sometimes, especially ones who've not ventured into partnership, that's a totally new, foreign, scary idea. They will say, what if the birth parent isn't safe for some reason? Or what if they're far away, they're incarcerated or something where I can't really get to them? And I learned this from one of my mentors, that it's still in your power to write a note that says, Joey got an A in spelling, or Joey made brownies, or Joey finished a book, or a picture of, things like that. You don't have to assume that you have to have, it's obviously best. We want that close relationship. But if that isn't possible for whatever reason, there's no reason you can't still send updated notes, because people, exactly what Belinda said, they want to know what's going on with their child. Even the scariest person wants to know what's going on with their child. So don't be afraid to reach out. It's so important. And as that power differential that Linda May talked to, it's a perceived power differential, but the truth is what it's perceived to be. So if they think you have power, whichever side of they you're on, then you have power, whether you acknowledge it or not. So use it wisely. And making those connections is really the best thing, because as I know Linda May and Belinda know, It isn't just the young people that are involved in care, it's the adults they're going to become. And we have to keep that in mind, that whole idea of who is this 9-year-old child going to be at 39? And what impact is my interaction with that child going to have? Because I can tell you, as someone who is in the wisdom years, that that connection has impact, even in your 60s and your 70s and your 80s. And I'm not that old, but I'm learning some of it, that it still has impact. So make it count, make that inclusive thing go on, make it happen.
So Jessica, I'm sorry, but I think that we're going to have to move on. We have one more presentation towards the end. So I just want to express a very special thank you to you, Linda May, as well as Belinda, as well as you, Jessica, for, kind of facilitating today's discussion. And I do see a couple more hands up there. And if you want to put your questions in the chat, or we can come back to you at a later point, we can follow up on those questions. But I didn't want to take away from the limited time that we have now for the last component of our day. And we have a really powerful group here that is going to follow the powerful group that Linda May and Belinda just did. So thank you both. And now we're going to turn it over to Jody. Jody Rogers.
Hi guys. Hello everybody. Good afternoon. My name is Jody Rogers and I am a birth parent from Sonoma County, California, and a member of the National Work Group. I have to start off by saying that I am so excited to be here today. And although I wish that we were in Seattle giving each other a very big, long overdue hug, I am just grateful that I get to see everybody here in this moment. And I also have to say that I just love seeing so many new faces joining together in this important movement. As you have been hearing, the Birth and Foster Parent Partnership, also known as the BFPP, National Work Group, developed 2 great tools to help build a long-lasting partnerships between birth parents, resource parents, and kinship caregivers. During the past year, we have introduced these tools to child welfare agencies and other service providers at the local and state levels all over the country. If you're interested in learning more about these tools, we are going to be offering introductory webinars to share more information about them. The dates for these webinars are posted up on the Alliance's website on the BFPP page. The new introductory webinar is scheduled on Tuesday, September 28th from 1 to 2:30 p.m. Eastern and 10 to 11:30 a.m. Pacific time. The BFPP National Work Group also holds monthly calls. So if you're interested in joining us during these calls, we're going to ask you to give Meryl Levine an email and she will make sure that she adds you to that email work group. So now you guys are going to have the opportunity to hear from some of the members of the BFPP National Work Group as they share their experience in using these tools. But first, I want to turn it over to Marquita and ask you, Marquita, to share how you got your treatment foster care agency involved.
Thanks, Jody. Hello, everyone. My name is Marquita King, and I'm a foster and adoptive parent from Maryland. It's really a pleasure to be able to share with you how our agency, the ARC, Northern Chesapeake region, embraced the concept of BFPP and the tools. I attended my first BFPP convening a couple of years ago, and it was such an enlightening experience. I mean, my heart was so touched by the stories, the struggles, the triumphs, and the lived experiences of birth parents. I knew I had to bring it back to my agency. So I contacted my director and requested to meet with him. He scheduled a Zoom and, excuse me, one of our social workers also attended. I gave an overview of BFPP. I went through the booklet on the tools and he immediately bought in. He then contacted the Children's Trust Fund Alliance. They mailed us the booklets detailing the tools. They scheduled the 3 trainings, and I'm proud to say that we held our 3rd and final training on the tools a little over a month ago. The concept was very well received by our foster parents. The training was provided by personnel from Children's Trust Fund Alliance, along with a birth parent and a foster parent, Robin and Jody. It was really effective to hear lived experiences from a birth and foster parent and how they formed a forever relationship. It was a model for our foster families. The training provided a wealth of knowledge in how to create and grow an intimate relationship between birth and foster parents. And now our agency is actually looking to build on the training we received by introducing BFPP to our county DSS. We're also in the process of identifying birth parents that might like to attend some of our monthly meetings, which have previously only been attended by foster parents. You know, excuse me, BFPP is a new way of doing business. It's not just a novel idea, it's an ongoing movement, and it should be embraced at every level of any organization. I think birth and foster parent partnerships are invaluable, hands down. And you know, even more than that, I think partnerships between the children are also valuable. Several teens that have left my home years ago are still in contact with my kids. They had no formal training, yet they have formed lasting relationships with my kids. You know, perhaps a subset of BFPP can be explored in the future and named Birth and Foster Family Partnerships, BFFP. It's really one family partnering with another, not just relationships parent to parent, but the children of the foster parents partnering with children of the birth family. I think these relationships directly affect how well the reunification of the foster child to their family plays out. In building relationships with birth parents, I previously had to pretty much rely on gut feelings and sentiments of the heart to know how to interact with birth parents. The tools provide the guidance and structure to make relationship building easier. You come away with knowing how to engage in a comfort call, what to say, what questions to ask, what information to share. You come away with ideas on how to communicate with each other, how to plan meaningful visits with the child. BFPP, it's a win-win for the child and the family overall. We actually have a couple of people from our agency attending the convening. Julia Harvey is a foster parent with the ARC, and she and her husband have fostered many children over the years. Julia, would you briefly share some of your experiences with birth parents and how you plan to use the tools in your day-to-day interaction with birth families?
Yes, I will. Thank you, Marquita. Good afternoon, everyone. My name is Julia Harvey. My husband and I have been fostering for a total of 26 years. 8 years with the ARC, Treatment Foster Care, Northern Chesapeake Region, and 18 years with regular foster care in Harford County DSS. Working with birth families can be both rewarding and challenging. My reason for saying challenging, because in the interim of meeting the birth families, most foster parents think in their minds that it's going to be easy, that the birth families are going to accept us with open arms. In some instances, that's not true. The relationship begins when we first meet the birth family. In most foster parents' mind, we want everything to actually go smooth. But in every instance, that's not the case. But what we have to do is not give up. We have to continue to work at the relationship. When we begin to work, at the relationship, we have learned that it's a give and take situation. It's not just I'm giving and you're not. Foster parents and the birth parents have to work together. When we begin to build that relationship is built upon constantly. It never, ever stops. That relationship is so important because it makes that child that's in your home feel really good when they see that the foster parent and the birth parents are getting along. And it's essential for the foster parents and the birth parents to work together in order for reunification to take place. So in my opinion, when working with birth families, mostly we work with the mothers. Mothers, we have to establish a relationship. The first way for us to establish that relationship is to build trust. It's to build trust. Trust is so important in the foster parent and the birth parent's relationship. And yes, we're both going into the situation with fear. They're afraid, and the foster parents are also afraid. But I have learned that if we give, we will receive. So in my opinion, I have worked with foster parents. I have worked with birth parents, and I have seen great results. So I would like to say I am happy. I'm excited to be a part of this change. Thank you.
Awesome. Thank you so much, Julia. Great. So BFPP is a national movement, and we have 3 other members from different states that I would like to extend an opportunity to share their experience in using the tools. We have Robin Roberts from California, Colleen Puckett from Georgia, and Paula Bidd Samuels from Texas. Could each of you take 2 to 3 minutes, no more than 2 to 3 minutes, because we're at the end of the day, to share? First, Robin, you can go, then Colleen, then Paula.
So hello, everybody. It's Robin Robbins. And heck no, I can't just take 2 minutes. Are you joking? It's the end of the day. We're all tired. Thank you for being here. We need each other. That's going to be my takeaway right now. I won't share stories as we don't have time for details, but I just want to back up what I heard from Jody and Marquita. And thank you, Julia, for sharing about the tools. So that's what this section is about. And, you know, we've been doing this work for a long time, haven't we, Jody, in our local area? But these tools were written by us, all of you, people who know and have the lived experience were the ones who put the tools in place. So they are amazing guidance. And now we have something we can walk around and show to people and use for guidance, as you said so beautifully, Marquita. And that's what we've been doing. We've moved from having to be those, for in my case, the foster parent who does things behind the backs of social workers, to being able to be open and honest and authentic about how and why we need these relationships. So we don't have time to go into the tools now, but please, I'm just going to put out a plug. Please, I need all of you. We all need each other to show up at these meetings that Jody mentioned to talk about these tools, because it's your input that's going to create these tools and the way they're presented to folks. So please join us at all those times and join us at the monthly meetings. I think that Jody shared how you can do that. Thank you to the new people who are here. I have a quick call out to Luke Nichols, who is the father we brought, because he's an amazing birth parent leader from our county, who also has been teaching me the way the other fathers and all of you mentors have, how to build these relationships. I couldn't do it without you. So I'm gonna quit without sharing the exact stories I had in mind, because we're short on time, but please, we need each other. And please and thank you. Please remember we need each other, that nobody really knows what the other person's experience is. So we need to ask each other and keep showing up and being strong and rattle those cages. Thank you for that, Jessica. Anyway, I'm going to turn it back to you, Marquita, and let other folks share.
Okay, Colleen, you can share.
Thank you so much. And like Robin, I will try to be as brief as possible, but it is hard to recap everything. So I thank you so much for letting me share today. So in Georgia, we've got a lot that's been going on. I got so excited when I saw the tools last year and I just hit the ground running. And since then, I was able to join our Georgia DFACS Parent Advisory Council along with other parents, kinship caregivers, and resource parents. And together we are working on giving out these tools. And one of the things that we are doing is we were selected to be able to present at our statewide Georgia Summit, which includes all of the stakeholders who have any input within the child welfare system in Georgia. And we will be sharing the tools and different ways that we can be working here in Georgia to be promoting these partnerships. I have also been able to work with our state agency on a pilot program in one of our counties, using the tools to work on icebreaker meetings. And we're making sure that those are not only happening just when a child comes into care, but anytime there's ever a change of placement, to ensure that those meetings are occurring between the resource parent and the parents. We also are working on some different trainings to go through our state foster parent trainings, as well as through our private agencies that are really encouraging parents' perspectives and working towards those partnerships in Georgia. I was excited to hear from Florida and Minnesota today, because I am actually in the process of working on legislation here in Georgia that's also working on comfort calls, icebreaker meetings, and really kind of working on getting those partnership legislation here in Georgia as well. And I got an email while I was in this of like, we're having a meeting probably next week, so let's start getting this going. So I was really excited to be here today when I was getting that information. Lastly, I like to sprinkle in some of the tools on my podcast, The F Word Foster Care, by having partnerships on and sharing those different stories and relationships to be able to promote and to encourage partnerships to those who are currently walking through their journey as well. So I'm excited to see where this next year leads all of us, and love all those tools. Thank you.
I'm just gonna jump right in. You don't have to tell me to do it. I'm good at that. So
yes, you are. Yes, you are, Paula.
Paula,
take it away.
Thank you so much. And I'm loud, and so I try not to be, so y'all might have to put your mics down a little bit or your volume down because I'm loud. But what we are doing here, what I'm doing here in Texas, we're trying to do it big, because they say you do everything big in Texas. So on Friday, actually, I am going to introduce these tools to our Texas Children's Commission, and we will be presenting at a later date, but I'm going to introduce them to all this information on Friday as I give my commissioner's report. And we've noticed that in Texas, we're getting more and more parents that are being a part of the BFPP, Birth and Foster Parent Partnership. And so, and this group of people, I know they are like on fire for everything dealing with families. And so now that they're involved in this, then I know that this will spread even further. We have Deshaun Ems on the call. We have Jessica Bills, I believe, and Verlyn Johnson, who are on here today, and they are now a part of the BFPP. And Deshaun is our child welfare CPS for those in Texas. She's our CPS liaison, so she can help us with things. And we're trying to get a meeting with the commissioner so that we can begin to present all of this. We had a changing of the guards. And so with the changing of the guards comes, new things and less time sometimes to meet with them. But we are trying to get that meeting. I've already been in contact with Deshaun. She's sent the information to individuals, and now we're trying to create a plan in order to present and to start putting this into practice. And I'm like you, Colleen, when I heard Florida and Minnesota, I'm like, okay, it has to change. They gave me some ideas. They had links in the chat. I've already pulled them up because I'm going to be presenting that to the commission as well, because sometimes we feel that we have to create the wheel, but the wheel has already been made. All we got to do is roll that sucker. And that's all I'm trying to do is roll that wheel, because they've already created it. And now we're trying to get it done in Texas, because we understand the value of partnership. There's nothing like partnership. I won't give my girdle example, but if you ever heard it, I promise you'll understand. There is such support when you have a partnership, and that's what we're fighting for in Texas. I think I did it in my time limit. I'm good.
Yes, you did, Paula. And actually that girdle presentation that you give is so awesome. If you haven't heard it, you really need to hear it. So thank you all, ladies. That was awesome to see how much work is going on across the nation, across our country. It's needed. It's so much needed. And it looks like we have maybe 5 minutes left. Is there anybody else who would like to share briefly about how they're using the tools in their organization or in their state? Feel free to just jump in.
This is Jessica. I'll jump in one sentence. I introduced it to our folks at DHS. They loved it. They have adopted it, and they are incorporating it in many, many levels of training.
Oh, that's awesome, because actually our director of our agency is going to be presenting it to our county DSS. So it's encouraging to hear that you had success. Hopefully we will as well. So I'm going to pass it back to Jody for any final thoughts, and then she can hand it over to Meryl for closing remarks. Thank you all. It's been a pleasure being here with you. Jody?
Yeah, I just want to say that like I am absolutely so inspired just hearing what everybody's doing in their local areas and just all around. And I know I had put this in the chat, but I'm just really grateful to be here. And I love my BFPP family. And I know in our area, we've really been, you know, hitting the ground running, trying to get our program, our partnership program up and going. And there's been peaks and valleys for sure, but I have to say that like we are taking off, and I'm excited to share about that at another time. And I just really, again, I can't thank everybody enough for coming with their whole hearts and sharing their lived experience. And with that said, I will pass it to Meryl.
Thank you, Jody. And I see a hand up here with April Doyle, and would welcome your sharing, but April, you are on mute. Okay.
Oh, thank you. I just wanted to say thank you. This was my first meeting. I'm from Rhode Island, and we're on a parent advisory board trying to actually change the Department of Children, Youth, and Family Service system. So you guys have all been super inspiring, and I'm just humbled to be here. I just wanted to say thank you.
Thank you. Great to hear that. Nice to have Rhode Island involved. So wonderful. I think there's quite a few Rhode Island people here that joined in. So happy to hear. Anybody else want to make any final remarks before we close out for the day? I know it's been a long 3.5 hours, but it looks like everybody was so inspiring to listen to. I hope the discussions were good. Any other final remarks from the group before we close out? I can't see hands. I don't know. I may need some help here. There's another hand up somewhere.
Meryl, this is Michael.
Okay, Michael.
Just wanted to say what an incredible group. Thank you all. It's so exciting to see Jody and Robin doing the work that they're doing, and Paula. Just knowing this team and where we've come over the years, it is pretty powerful, incredible. Jody and Robin's work has made its way down to San Diego and continue to do their work and highlight what the value is when we are seeing partnerships like this one. So super exciting. And I know my colleague Timothy had his hand up, so I just wanted to say thank you all.
Thanks, Michael. It's good to see you. I'll be real quick. I guess for me, I will do work here in Oregon, and it can be really challenging. Sometimes you can feel like you're fighting a system and you're pushing and it's hard. And I feel a lot of times like we get a sense that we do that in isolation, and it sometimes can feel like, even though I have a great team around me, can feel undoable and daunting and really challenging. And so what this does, and what this has done particularly today, is it opens up to a much wider world of the work that I do here locally, and lets me know that other people are stepping up to meet these challenges as well, and that I'm not doing this kind of stuff alone. And so you all just have been incredibly inspiring, and I appreciate everyone sharing the work that you do, you know, and keeping moving forward. So thank you.
Thank you, Timothy. And I see, Jody, you have a hand up, and then we're going to be closing out.
Yeah, so I just wanted to say to those of you that this is your first BFPP meeting, I want to welcome you and tell you that you just stepped into an incredible family. And I just wanted to share the first time that I came to a BFPP convening. I was a nervous wreck. I didn't know what to think. And I was around all of these people that just wowed me, like my heart. I was like, oh, I want to be just like them, you know? And I'm grateful that all of these amazing leaders have a way of just taking you under their wings, from Meryl to Kara to Michael to Timothy, like, and just really walk alongside of you. So welcome to the family. It just gets better every time.
Thank you, Jody. And I want to really express a very special thank you to all of you who have participated today. We really appreciated all of the sharing that you've done in the chat. It's been a really active chat box. We hope it'll be the same way tomorrow. We've got a full day scheduled tomorrow for you as well for the same time frame. We want to make sure that you use the same link that you linked into today for tomorrow as well. And we also will start right on time. It would be 9 o'clock Pacific, 10 o'clock Mountain, 11 Central, and 12 noon. And now I'm going to turn it over. We have like 3 minutes left to Kara to do the closeout on the door prizes. And we'll look forward to seeing you all again tomorrow. And I want to say one more thank you also to the 3 partnering organizations, our Children's Trust Fund, the Casey Family Programs, and Youth Law Center. Thank you all for your support in putting together this event today with us. So, and with that, Kara, I'm turning it to you.
Thank you so much, Meryl. And thank you everyone for joining us today. It has been a whole time of just being like inspired of like, what else could possibly this group be doing, right? Like, where else could you be doing this amazing work? And so, as Jody said, welcome to the BFPP family. To those of you who are new, welcome back, and nice to see you. To our BFPP family as a whole, it is wonderful to be back in even just a virtual space together. And I get to close out in the best way possible, which is my 2 favorite things. 1, announcing more door prizes. And secondly, closing out with a closing song. So I have a special song picked out for us as we close, but our final winners for today. Are you ready? Here comes the first person. April Doyle, you are a winner. So you will be getting an Amazon gift card. So welcome, welcome. And we also have a door prize going to Eddie Torres today, to Stacy Coletti, and last but not least, to Doreen Britt. So those are our lucky winners for day 1. I encourage you, sign on a few minutes early tomorrow. Hint, hint, door prizes. Sign on a few minutes early, because we'll be watching to see who is going to be some of the first people who are going to come into our waiting room before we open up tomorrow. So just thank you for spending so much time with us today. We greatly appreciate it. And each and every one of you for all of what you give and do in each and every part of your day.